I did. I said that Ellen is, I believe, ready to go.
Okay. Ellen Pines?
Yes.
Welcome, Ellen.
Mr. Chairman?
Yes, go ahead.
Excellent. Thank you, Mr. Chairman. And I hope there are a few members of the committee who have come back on. Ellen Pines, representing the Disability Coalition. I wanted to thank the committee for a very interesting discussion this morning. The discussions around workforce in healthcare, I think, are always really important. And it's an opportunity for me, on behalf of the disability community, to remind all of you that when it comes to people with disabilities, it's not just about doctors and nurses. We appreciate the heightened interest there's been in the last several years on behavioral health providers. But again, the needs of people with disabilities go way beyond that. And I think that Dr. Larson is probably long gone from the meeting, but I wanted to thank him for adding physical therapists and occupational therapists to their tracking this year. I'm still wondering where the speech therapists are, but I assume they're coming soon, and I certainly hope so. But I want to remind the committee not to forget direct care workers. When I use that term, I'm referring to the people who provide actual hands-on daily care to people with disabilities, including our seniors. And that means the aides in nursing facilities, the personal care attendants who provide services in people's homes, workers in group homes for folks who have intellectual or developmental disabilities. These workers are incredibly important for people with disabilities, including seniors. I don't know if any of you noticed this as we were going through the slides, but one of Susan Wilger's slides had projections of increased needs in healthcare by sector. She didn't dwell on this, so it probably jumped out at me more than it did to you. But one of the lines in there was personal care aides. And the noteworthy thing about that wasn't just that there was a projection of an increase, but it was by far the largest percentage increase of any of these workers on her table. So there is a real need to pay attention to this workforce and to make sure that we have adequate numbers of qualified people to do the work, because as I said, it's absolutely essential to the population of people with disabilities and frail seniors. Unfortunately, it's not a very much appreciated workforce in the sense of societal recognition. They tend to have very low pay. They don't get much respect. It's a profession where it's hard to recruit people, constant need to recruit people, and very high turnover. And I would really like to encourage the committee and the legislature as a whole to take an active role in supporting this workforce, because we really need them. And if we don't support them, we won't have them. And as I've probably noted in the past, this is also a matter of equity. This is a workforce that is overwhelmingly female and disproportionately consists of people of color. And as a matter of fairness, we need to ensure that we are treating them right when they are providing these important services to us. The Medicaid program is a huge payer for these services, and therefore it's a proper role for the state in that regard, as well as just generally. We have been working with the Human Services Department on this, but I'm sorry to report that we're not making particularly good progress. Committee members may remember that I was on a panel presenting to you last year along with Secretary Scrace, and he certainly wasn't very receptive to what I'm saying, and our interactions with HSD since then have not been particularly promising, but we're continuing to work with them. On a totally separate matter, I just wanted to say a brief word. I know that your committee doesn't make this decision. It's up to the Legislative Council and the leadership of the legislature, but I'm sure you all have a voice in it. And I expect that most of you would agree with me when I say we really hope that you will be able to open up the roundhouse to public participation, at least to some extent, during the regular session that starts in January. I and my colleagues and my constituents are very appreciative of the opportunity to participate through the WebEx or the webcast, but it is definitely not the same thing. So I hope you all are using your voices as members of your respective chambers to push for some opening during the regular session. We miss being able to interact with you, and we hope that you miss being able to interact with us as well. Thank you, Mr. Chair.
Thank you, Ellen. That last comment is, I think, weighing on a lot of our minds. If we had regular testing with quick results, that would certainly make it possible to do that. I'm not sure, short of that, how we would, but it's certainly something that we're all thinking about and trying to figure out some way to deal with. Nancy, were there any other public comments?
Yes, I have Kat Sanchez.
Please, Kat, would you introduce yourself and make your comment, please?
Yes, sir. Thank you, Chair and members of the committee. My name is Kat Sanchez. I'm a policy associate with Bold Futures, and I'm joining you from Las Cruces. For many years, we have worked with the licensed midwives to make sure families of color and low-income people across New Mexico have access to high-quality perinatal care in their communities. In New Mexico, there are two types of midwives, licensed midwives and nurse midwives. Licensed midwives can train at a midwifery school or through an apprenticeship model, and they specialize in caring for low-risk pregnancies, support during labor and delivery, and care for newborn babies. They can provide care in multiple settings, but here in New Mexico, mostly work in birth center and home birth settings. Though licensed midwives are a critical element of the perinatal care provider infrastructure, they are not often included in discussions like today, and they are also unfortunately not often included in data about New Mexico's provider landscape. The COVID-19 pandemic has laid bare inequalities that already existed in healthcare. More families than ever are seeking home birth or birth center care as a way of reducing that risk. NMDOH, Medicaid, and the state need to continue to explore how to remove barriers and better support licensed midwives. On page 15 of the workforce handout from the previous presentation, there was a showing of healthcare shortages across the state, and New Mexico has a shortage of 59 OBGYNs. This is an area where having a licensed midwife could alleviate strains that our rural communities are already experiencing. Though the state's budget has been and will be further constrained by the pandemic, supporting providers is absolutely necessary during this time frame. We urge anyone bringing provider tax credit bills to include licensed midwives, certified nurse midwives, and almost all other perinatal care providers are already included. So to not include licensed midwives does create disparities. As previously mentioned, mid-level healthcare providers can benefit more significantly from a tax credit than healthcare providers who already are in higher tax brackets and for which credit of several $1,000s may not make a big difference, but it does to licensed midwives. We again urge the members of the committee, other legislators, and state agencies to better include and center the needs of licensed midwives and the communities they care for in healthcare decisions and adaptations for COVID moving forward. Thank you for your time. And Chair, you're on mute as well.
Thank you, Kat. And are there other comments from the public?
I have a call-in user. I'm hoping that's Representative Garcia. I'm not sure. And then I have a Cherry Dotson, and I'm not sure if they would like to make public comment as well.
Did you want to make public comment? You can introduce yourself and begin speaking.
If not, Mr. Chair, that is all I have.
Okay. Is there anyone else who wanted to make public comment? You need to let us know so we can schedule you at the end of the afternoon. I'd like to move now to adoption of the minutes of that September 4th meeting that I mentioned this morning. It was distributed to us, and I hope you've had a chance to read it over. Are there any discussion of that particular document? We've established a quorum, and if I could get a motion to adopt that, that would be really useful.
I move to adopt the minutes from the September 4th 2020 meeting.
Good.
Mr. Chair, this is Joanne.
Yes, thank you, Representative Ferrari. Any discussion of them? Any corrections or questions about those minutes? The one thing I would say is that in the discussion of the, and I'm trying to call it up and I'm having a heck of a time here. Let me see. In the discussion of the insurance pool, it doesn't come through clearly that what was being discussed was the high risk pool. And so just with that one little addition, Sabina, I think that would clarify it. You could make clear that that's the high risk pool. Here we go. It was on page, it's on page 5. On page 5, comments from committee members included the following. And it's not clear that we're talking about the high risk pool there in that section.
I will make that change, make that a little bit more specific. Yeah, thank you for pointing that out.
Okay, good. Thank you.
Oh, and Mr. Chair, I just noticed on page 4, where it says at the very second to the last line, Be Well, New Mexico. It should be capitalized, Be Well, and then I believe NM also capitalized.
Yes. Okay, with any other corrections or additions? Yes? Okay. Seeing or hearing none, are there any objections to the adoption of those minutes? Seeing none, we'll consider the minutes to have been adopted. And now we can move to our agenda for the afternoon, which will be addressing the nursing shortage in New Mexico. Now we're a little early, so I'm not sure all the panelists are here. Have we checked that? We're planning on having a panel of Jenny Landon, the Dean of Nursing at the Santa Fe Community College, Bill Mccamley, the Secretary of the Workforce Solutions Department.
Howdy.
How are you, Mr. Secretary? Good to see you again.
Ms. Chair, I haven't seen you in like 3 hours.
I know. It's Ricky Cerna, the Deputy Secretary.
He's right next to
Deborah
whenever
Walker.
you're ready.
Okay, and Deborah Walker, the Executive Director of New Mexico Nurses Association. And are you going to kind of quarterback this panel, Mr. Secretary?
Ms. Chair, I was just told to be here and present a presentation. I'd be happy to do so if you would like. But I mean, it's at your pleasure, sir.
Okay. How about you, Deborah? Were you planning on being the driver of this particular vehicle?
I think everyone is present and ready to speak to you, and then
Okay.
we're all capable of sharing time and space and answering your questions writ large. So thank you.
Okay. Well, let's just take them in order then. We'll start with Jenny Landon, then we'll go to the Secretary, the Deputy Secretary, and then you, Deborah. So, Jenny Landon, if you would introduce yourself and begin, please. You may need to unmute yourself. Yes.
Can you hear me now?
Yes, now we can.
Okay, all right. I'm not used to this platform. Sorry about that. Thank you, Mr. Chair. I may need to turn off my video. If I do that, please excuse me, but it's because of connectivity issues, but hopefully we won't have any. I know that I submitted a PowerPoint. Do you all have access to that PowerPoint?
I think Nancy will help you with that.
Okay, great. Maybe while Nancy's getting it up, I'll just do a brief introduction. So my name is Jenny Landon, and my background includes over 30 years as a family nurse practitioner with the past 11 years in higher education at Santa Fe Community College in Santa Fe. I have a master's in nursing education, and I'm currently, fingers crossed, finishing up my dissertation with a PhD in nursing. So that's my background there. So I started out as nursing faculty 11 years ago and then became the director of the nursing program at Santa Fe Community College. And for the past 6 years, I have served as one of the 3 deans. I don't know if we're going to be able to see the slides or not, but I'll just keep going, I guess.
Trying to figure out, sorry, one second.
That's okay.
There we go.
Which one?
Maybe let's see. Is it the LFC hearing? Try that one.
Nancy, it's Andrea.
Yes.
I will check with Seth. Apparently, there were a number of presentations that were sent to us, and unfortunately, Dr. Landon may have slipped through the cracks. So let me see if we could get this one up. I know Linda sent it to me, and I just sent it over there during the lunch break. So just bear with us for a moment, okay? Thank you.
I'll just keep talking.
Thank you, Dr. Landon.
Sure. And I'm not a doctor yet, but thank you. That sounds really good.
PhD candidate Landon.
Couple more months. Right. All right. So as I was saying, there we go. That's perfect. Okay, and you can just stay on that slide for a minute. Thank you. So as the dean and Santa Fe Community College, we've been involved with New Mexico Nursing Education Consortium since its conception in 2009. I have also been on the NMNIC Leadership Council for the past 7 years. So after reviewing the Legislative Finance Committee evaluation report on nursing expansion in the workforce, I would like to share my insights on the issue of nursing education and the demand for nurses. Next slide, please. The LFC report acknowledges the Institute of Medicine report from 2011 in regards to 8 national recommendations that were made for expanding the national nursing workforce. The community colleges and universities that make up NMNIC, or the New Mexico Nursing Education Consortium, took on recommendation number 4 back in 2010 when it came out, which was to increase the proportion of nurses with a baccalaureate degree to 80% nationally by 2020. New Mexico Nursing Education Consortium received a grant from the Robert Wood Johnson Foundation over the course of 4 years to assist in this endeavor. The grant has been over for a couple of years. New Mexico is not yet at that goal of 80% by 2020, and neither is the nation, but the dial is being moved in the right direction. Next slide, please. In 2015, I had the honor of attending a hearing for the National Academy of Medicine, which was formerly known as the Institute of Medicine, for the purpose of sharing the work that's been done in nursing education in New Mexico. We were able to share our partnership model in New Mexico between community colleges and universities as an example of academic progression for nursing. The purpose of the hearing that I attended was to hear testimony from across the nation in regard to the progress of the IOM recommendations from 2010. The follow-up report was published in 2016, which is what you see on this slide, and I'm proud to say that the NMNIC model of New Mexico was included in this publication as an exemplar of academic progression in nursing. Next slide, please. The Academy's findings and conclusions also include such important items as recognizing the value of the associate degree nursing programs as an entry into nursing pathways for disadvantaged and underrepresented populations. Next slide, please. Now, many of you may have seen this slide before. NIMNIC schools have been successful in increasing the number of BSNs or bachelor's prepared nurses graduates, but they have not been able to increase the total number of new nurses entering the workforce. These schools are to be commended for their success in New Mexico for transforming multiple traditional nursing education curricula into a single transferable statewide curriculum for pre-licensure nursing education without much more additional funding or resources. Now, the lack of the licensed practical nurse or LPN education integration mentioned in the LFC report was not initially addressed by the NIMNIC model. However, as you can see here on our current NIMNIC model, that oversight has been addressed. Currently, the New Mexico Board of Nursing has vetted and approved an LPN transition course, which is offered by only Santa Fe Community College, but available for students statewide that will allow any pre-licensure nursing student who has passed the course and met program requirements to license as an LPN in New Mexico. Some colleges are also integrating LPN certification within the NIMNIC pre-licensure RN curriculum. SFCC, or Santa Fe Community College, has now taken a step even further and implemented the LPN pathway at the high school level, which will not only create more LPNs for the workforce, but will also support local high school graduates the opportunity to stay in their communities and attain an associate's or even bachelor's in nursing. Next slide, please. Santa Fe Community College's unique dual credit partnership with Capitol High School in Santa Fe allows students to graduate from high school and license as LPNs. These LPNs can enter the workforce and or matriculate seamlessly into the college's nursing program. Next slide, please. Nursing programs are working diligently and creatively across the state to serve as many students as possible. But without additional funding, programs lack the faculty to increase the number of nurses needed to fill the workforce demand. More funding is needed to compensate current faculty at the competitive level that they deserve to retain them, and then to recruit and hire additional faculty to increase enrollment. Currently, New Mexico Board of Nursing regulations require one nursing instructor to a maximum of only 8 students. But due to COVID, many agencies across the state are limiting clinical group size to only 4 students, which means more faculty are needed. In addition, my experience in piloting an additional evening weekend cohort was challenged by the lack of faculty willing to work those shifts without additional compensation or above and beyond their already 40-hour work week. In addition, we need incentives for clinical partners such as hospitals to be able to provide more clinical instructors on a pro bono basis so that nurses can act as faculty as part of their normal workload or as part of their clinical promotion ladder. Next slide, please. This is a picture of our first LPN cohort of high school juniors last year in Santa Fe. They are now seniors in high school and are expected to graduate in May and then license as LPNs. If we want to grow our own diverse nurses who reflect the diversity of our communities and want to stay in our communities, we need to ensure that we have enough faculties to support their success and create growth in enrollment. Next slide, please. We have learned in nursing education throughout the state to be creative in sharing of classroom and lab spaces. We are constantly forming new innovative clinical partnerships, including working with school districts, public health offices, vaccination clinics, and home health agencies. What cannot be replaced is the qualified faculty that are missing to expand enrollment. The pipeline for diverse nurses who want to work in their local communities is only limited by the critically needed increases in faculty funding. Next slide, please. There's a reason that nursing education is known to be rigorous and challenging. Nursing is frequently voted as the most trusted and noble profession. It takes a tremendous amount of resources to create nurses who we can trust with our lives. The most valuable resource to creating more competent nurses in this day of rapidly changing technology and epidemiology of disease and illness lies in having enough qualified faculty to meet the demands of today's nursing education and keep up with our workforce needs. Next slide, please. Thank you for your attention to this critical issue. I was told I only had 10 minutes, and I now stand for questions.
I think we'll hold the questions until all the panelists, and then we'll deal with them at the same time.
Certainly,
so thank you very much. Thank you, almost Dr. Landon. Thank you. And we'll go then to the Secretary of the Workforce Solutions Department, Bill Mccamley.
Thank you, Mr. Chair. So myself and Rick Serna have passed along a PowerPoint presentation. Would it be possible to put that on the screen?
Secretary, we'll work on getting that up. Just give us a moment, please.
Sure.
If you could just point out to me which one. Is it this one?
No, ma'am.
Can you see that screen, Bill? Can you pick out yours?
Oh. That's not it.
And then this is the one we just heard.
Yeah, so I sent it over to Amy Chavez Romero last week, and she said she'd pass it on to the right person. Can I email it to someone? I've got a copy.
Yeah, you can.
Or that would be great.
Okay, who do I email this to?
You can email it to nancy.martinez@nmlegis.gov.
Ms. Chair, do you want to move on to the presentation from the Nurses Association while I send this over, just in interest of time?
That sounds good. Let's do that. So we'll go to you, Deborah. Deborah Walker from the New Mexico Nurses Association.
So, Mr. Chair, Madam Co-Chair, and members of the committee, I am Deborah Walker. I am actually, I'm one of the licensed registered nurses that shows up in your survey data, your supply data. And most likely I show up as not practicing in the state of New Mexico, for I don't engage in any kind of direct patient care. Rather, I have the privilege of being the executive director for the New Mexico Nurses Association. And on behalf of the nursing community in the state, we want to thank you for holding this hearing virtually. We're acutely aware of the data right now on our positivity rates. So thank you for doing the virtual hearing. We have submitted written testimony. It is on your handouts, and I am hopeful that when you have not had to spend the day in a virtual meeting, that you will read it. Use it as a reference point for the success that you've had, the investment that you've already made over the last 3 decades in a bipartisan, bicameral fashion with the nursing workforce here in New Mexico. And then also use it as a reference point as you look at your priorities in November and in the 21 legislative session. I wanted to loop back to the workforce study very briefly and recognize the work that Dr. Larson and particularly his staffer Amy did in your workforce report this year. There's a new graphic in there that I think all of us will come to value. And what it shows is the age and the diversity of the workforce. With regard to nursing, when I moved back to the state, my talking point, the bullet point. Andrea, are you talking? I'm getting feedback. My talking point when I moved back was that nursing and medicine in the state of New Mexico had the oldest workforce complements in the nation. That is no longer a bullet point that any of us can use, and you all should take credit for that because of the investment you've made over time in nursing education. We now have a mean average age of the nurse in practice of 47. That is to be celebrated. In terms of the diversity slide in the data workforce group, it's not what I had hoped, but the fact that nursing is one of 3 of the professions being followed, to have roughly 30% of our practicing nurses fall into Hispanic population is progress. It's not where we want to be. I do want to highlight for you one initiative that, because it's outside of general fund, doesn't come to your attention. And that is an effort by the New Mexico Native American Indian Nurses Association, a small association that affiliates with NMNA. And they have been able to get meager funding through the Nurse Excellence Fund at the Board of Nursing to create a small scholarship program that is paired in a mentoring model. The data point that they use is that roughly 60% of Native students graduate from college. The Native nurses that have entered this particular scholarship mentoring model are at different phases of their education, but none have dropped out. Of those that have graduated, they have all passed the NCLEX, and they are currently in jobs here in New Mexico. So small steps, an N of 20, but a committed entity to try to increase the number of our Native nurses in the state. The rest of the time that I have, I want to spend on items that we hope you will take a look at. Several have general fund dollar implications, and we're cognizant of the constraints there this year with the state of the state, but a couple do not have general fund implications. The first that we feel very strongly about is that it's time to codify and fund the chief nurse officer position within the Secretary of Health's office. This is a position that currently exists, but is unfilled and unfunded. Under different administrations, this role has taken on different iterations over time, and we believe that the job description could fit both legislative and executive needs at this point in time. So if the legislature and the executive at some point undertook nurse residencies, for example, for the new grad, for the novice nurse, that position could develop and implement the competitive grants process. It could oversee the development of a nurse residency that could then be used by any facility in the state, so that rural hospitals, small rural facilities would not have to invest their dollars up front in developing and reinventing a wheel. We think that the nurse residency should, if indeed the state invests dollars in it over time, should reside in a state entity, not with a nonprofit such as NMNA or someone else. That position could also be used to look at effectively the maldistribution that we have in our nursing workforce and look at the issues around clinical placement sites for our nursing students at all levels, those kinds of things. So small 1 FTE, lots of things that you and the executive branch could use it for. The other 2 recommendations that we have that require general fund dollars are in the data workforce report that you looked at this morning, and you did touch on it briefly. Those specifically are increasing the number of RNs by 30 in the public health division at the Department of Health. We saw an evisceration of our nurses in public service over the last 10 years. And while this administration has done a good job at trying to fill positions and use contract nurses, we still have a high level of contract nurses in public health. And we think it's time to evolve back into nurses in career positions through state service. We also think it is just time, given the pandemic, that we need a school nurse in every district. So roughly right now, this is baseline, and it's time to invest and have that roughly 15 FTEs addressed. The next 2 do not require general fund investment, but rather would come out of the dollars that the Board of Nursing has through collection of our licensing fees. And the first one is that there would be a statutory change within the Nurse Practice Act to require the Board of Nursing to set up a portal to collect the data on nurses who reside and have licensure in another state, but come to New Mexico to practice under the multi-state compact privilege. On any given day, we do not know how many of those nurses are practicing. We do not believe that employers will collect this data. They don't want it out there in the aggregate, let alone system by system. They will view it as an unfunded mandate and another stressor when they are already stressed. The reason we think it is a Board of Nursing function is that's where we get our supply data, and we believe that the board can absorb it. The final fiscal issue is that we do want a statutory change in the Practice Act to increase by 2 the number of nurses on the Board of Nursing. We have seen, since that language went in almost 3 decades ago, nursing has evolved, nursing education has evolved, the complexities and practice arena have changed. And we want to ensure always that we have someone with a background in nursing education, an advanced practice nurse, and now potentially an LPN on the board. So those additional slots are needed. And finally, I want to bring your attention to what is on your website with regard to not only the testimony, but attachments. The first is really, in my view, a retention issue, and that is the personal protective equipment or lack thereof for our nurses who are at the bedside. We are far from being at pre-COVID supply. We think we have a very fragile supply system. And when I hear from my nurses that they are wearing cloth masks in clinical settings, it is beyond comprehension. We cannot find here or even nationally hospitals that are not reusing their N95s. And in the testimony, I detail why that is a concern. There is no data, no good research on the unintended consequences of the hydrogen peroxide process on nurses' lungs. The other thing that is addressed is safe harbor. And there is a survey that we did recently on Safe Harbor. Your committee endorsed the concept in the interim in 2018, supported legislation that was enacted during the 2019 session. And from what we can tell, there's nothing you need to do in 2021, but rather the onus is on our professional associations and the employers to continue to gather data on Safe Harbor. Safe Harbor during the pandemic is a different issue. We have nurses that will not invoke Safe Harbor out of a moral responsibility to their employer and to their patient, but we are far from having the staffing levels that are needed to, in some places, to provide safe care. Employers believe they have met the letter of the law, and I believe that both NMNA and the Hospital Association have further work to do, and we will report back to you in a year on what is happening on Safe Harbor. So you have written testimony and attachment. You have 2 surveys that we conducted. And with regard to PPE, it is our intent after the December holidays to do another survey so that you will know from the nurse's optic what is happening at that point in time. So with that, I will stop and turn it back over to our secretary. Thank you.
Thank you, Deborah, very much. Nancy, do we have Secretary Mccamley's presentation ready? There it is. Good. Go ahead, Mr. Secretary.
Thank you, Mr. Chair. We'll be going over the first few slides of this and then turning it over to Rick Serna for the last half. He's our Deputy Secretary and has been working on nursing specifically. If you can go to the next slide that says Project Summary. Nancy?
She did.
Okay. I guess I'm only seeing the first slide that says Legislative Health and Human Services Committee. Anyway, so Project Summary. When I first got this job, the governor asked us to take a look at where the holes were in the workforce in New Mexico as a whole. And it didn't take too much digging, as you've probably heard all day today, to learn that nursing was not only an area of very critical concern, but was also the biggest job need we have in the state. It's the single largest employment sector where we've got needs, and we'll be talking about that later. But what we wanted to do was then basically put a plan together that included a pipeline for the industry, career ladders like the LPN programs that the Dean from Sanford was talking about earlier, all of the strategies for completion. That's one of the things we hear is one of the big issues is people get in and trying to make sure that they complete their educational situations. Retention is a huge deal. What kind of policies need to be changed in order to make sure we do a better job recruiting and retaining nurses, and as always, funding, which you've heard before. If we could go to the next slide, please. The project to date, we put a task force together in 2019 that included folks in the Department of Health, our own folks at Workforce Solutions, and the people over at Higher Education. And we were able to actually hit some milestones. We had identified all the proper stakeholders. We talked about the public organizations and committees, all the umbrella associations, including NEMNEC, the Nursing Association, and folks like that. We actually put a task force together using what we call a sector strategy approach. And this is something that is important for developing jobs and economic development in the state as a whole. And what that means is you put the employers in a room and everybody else sits on the side of the room and stops talking. And you listen to the employers. And Secretary Serna actually led a couple of these discussions with a lot of the hospitals, clinics, and other employers, healthcare employers here in the state. And we were able to actually learn a lot about what their needs were, how we might be able to meet that. Mr. Chair, that's really important that we do that as a as a whole, because a lot of times when we in government or education or nonprofits, we like to kind of push things a lot. And sometimes we don't listen to the folks actually doing the employing. And that leads us sometimes down the wrong road. So we really wanted to take that employer-centric approach, and that's what we did here. We identified a lot of the providers that we need to be working with in order to hire nurses. We had those 2 convenings, so we basically brought everyone together and had these meetings I just told you about. We actually put together a survey of a lot of the health providers in the state, and then we drafted a report with recommendations. If you can go to the next slide, it actually talks a little bit about what that sector partnership strategy is. And if you'll see that little, is that not working, Mr. Chair?
It's not moving. I'm not sure why.
Sorry, I don't know why my arrows won't work. I promise you I'm trying.
One more.
There it is. There we go.
There we go. So if you'll look at that little graph to the top right, you'll see that's exactly what we're talking about. We're the employers, in this case, the private sector and nonprofit businesses that are in the middle, they actually literally sit in the middle of the room. And you put your K-12, your community colleges, your universities, our workforce boards, the other folks around the outside of the room. And so the employers are the center of the conversation. And it's a really effective way of trying to actually say, okay, what do we need here? Because they're the ones that are doing the hiring. If we could go to the next slide, please. Here you'll see a list of all of the folks that we brought together to start working on this. You'll see it's pretty much everyone we could think of in the state in terms of all the government agencies and educational folks. If you go to the next slide, you'll actually see a list of all of the facilities that we brought in. So as many of the folks as we could look at that were actually hiring nurses from around the state, we brought in to ask their opinion. And if you'll go to the next slide, you'll actually see a graph showing where we are in terms of current demand for nurses. And when I say that the nursing field is our biggest need, that did not stop being a thing. Now, what you saw a little bit if you look at the right side of your graph, is that went down a little bit in the beginning of the year as a lot of the elective healthcare issues were shut down across the state for the pandemic. However, as soon as those were reopened back up again, you'll see the demand shoots right back up again. And as of July of this last year, we had 4,856 nursing openings in the state that were not being filled at this time. That has been a consistent need for the state of New Mexico. If you'll go to the next slide, you'll actually see the breakdown by other online job postings for selected occupations as of July as well. You'll see nurse practitioners are very high. But what we're trying to show here is that healthcare as a whole is the biggest job need that we've got in the state of New Mexico, and nurses are the biggest group of that healthcare need in terms of folks that we need to hire. And if you go one more slide, you will see our projections where registered nurses, we're going to need 1,240 registered nurses between 2018 and 2028 in the state of New Mexico, and we are falling behind that fairly consistently. So I will turn it over to the Deputy Secretary, Rick Serna, to kind of go over some of the opportunities and the rest of the findings from the group. Rick?
Thanks, Dr. Mccamley. Nancy, if you can go to the next slide, please. I just we'll get into some of the challenges and opportunities that emerged during the conversations we had. And if I recall correctly, Mr. Chairman, I think you were at one of the convenings we had here in Albuquerque some time ago. It was August of last year. And over the course of about 10 months, the organizations that you saw in the previous slides came together to really identify the challenges and opportunities for the state in meeting the nursing demand and right now and for the long term, and I'll go over some of those now. Part of the work that we did was to really understand where post-secondary institutions were with regard to the supply side of RNs for the state of New Mexico, and to be sure, there's a number of things ranging from the wages that they're able to pay faculty in comparison to what those practitioners, those registered nurses could be paid at other hospitals. During the time that we did a lot of this work, a lot of the facilities, namely hospitals, were able to provide registered nurses with significant sign-on bonuses that not only did a good thing to get not only competed with post-secondary institutions, but they also competed with one another, right? So if you had an RN over in Taos, for example, that RN might leave the position in Taos to get a sign-on bonus in Santa Fe somewhere, leaving Taos with a 4 or 6 month battle to hire a replacement. Post-secondary institutions also, of course, wrangle with low student retention in the programs because it's a very rigorous program that starts with, entrance requirements and milestones along the way. And the low supply of experienced specialty nurses is something that New Mexico, of course, wrangles with on an ongoing basis. One of the struggles on the post-secondary side in terms of increasing its total output is limited clinical placements within healthcare facilities. So as you all know, in order to complete your nursing program, that clinical work is of course not just required, but it's essential to preparing you to work in the field. And if there aren't enough facilities within close proximity to that post-secondary institution, then oftentimes the institution is limited in how many students they can have in the clinical placement at once, thereby limiting its total enrollment. What may happen sometimes is that post-secondary institution will send those students to other cities where there again, those students are likely to be hired by that facility, and then the shortage remains within the town where the student graduated. There's also, it's also been identified that there's a misalignment between secondary and post-secondary expectations, and this is no, new challenge and not just specific to RN. So certainly later on when you see our recommendations that came from the group, connecting these nurse prep programs to provide consistency across the board, now that NEMNEC has established that statewide curriculum, that it'd be simpler to start moving the secondary sector in a more consistent manner. The group also recognized a significant reduction in LPN programs across the state over several years, and especially insofar that long-term care facilities are concerned, the LPN programs are still very critical to healthcare in New Mexico. So you'll see recommendations around increasing the number of programs and graduates from LPN programs. And then, of course, there's a high turnover in RN faculty across the state and a low representation of minority, namely Native American and males within the state. And of course, because the profession is very intensive, depending on where you practice, the burnout is oftentimes the primary reason why there's a change in RN vacancies across the state. Next slide, please. So one of the things that we did was, of course, try and understand what kind of resources the state of New Mexico is putting into post-secondary institutions across the state. And you're all familiar with the below-the-line appropriations that go to post-secondary institutions that help expand capacity. This is a breakdown of those for FY21, totaling about $4.6 million. And if you go to the next slide, you can see that those were supplemented by the additional 4.1 million for some of these additional special programs. So combined, over $8 million of special appropriations going to post-secondary institutions across the state. In the LFC report that came out earlier this year in the summer, I believe, found a couple additional appropriations that we didn't swoop up in our study, and they're able to point to what change in enrollment and outputs these funding sources yielded for the state of New Mexico. So that's a good source. Next slide, please. We'll start getting into some of the recommendations. So the committee that convened over the course of several months identified 4 different challenges and a set of recommendations for these challenges that it's a pleasure to present to you all. It's really the first formal presentation to a legislative committee we've given after all of the work is done, or after all the work was complete. But the first challenge essentially relates to increase the number of qualified applicants to post-secondary RN and LPN programs. And this essentially is the pathway, right? How do we create a pathway of prepared students to enter into post-secondary programs, which we believe will help on the output side because it'll mean they're more likely prepared to be successful in those programs. As you all may know, the Public Education Department administers CTE funding that that districts can use to create healthcare pathway curricula to better prepare high school students for a career in the healthcare workforce. And one of the recommendations included convening these districts together and actually developing a statewide common curriculum for RN preparation on the secondary side, so that rather than allowing districts to develop their own programs that prepare students for healthcare occupations broadly, how might we be able to more consistently prepare them for a profession in RN and registered nurse specifically? Create standardized medical careers, pathway curricula in high schools. We've seen some models that are doing very well, but standardizing them would actually help us better understand what the impacts of those programs are. For example, in Santa Fe at Capitol High School, they have a phenomenal program that prepares students for careers in healthcare occupations. But the program, even though it's been longstanding, it is not collecting data on student matriculation, on student outcomes, how many of the students actually will graduate from a program in the healthcare industry. So standardizing these pathways and the curriculum for these programs will help us better understand how successful they are in actually yielding a student who will matriculate and complete a program. We recommended that standardized dual credit coursework pathways is also a sound recommendation, because not only will it help students alleviate some of the cost of attending an RN program ultimately, but of course, understanding how we create a set of dual credit courses that better prepare high school students for an RN program once they graduate is also a good use of the dual credit program, which already exists. And then, of course, increasing the number of LPN programs across the state was a priority for this group, and using models like the one that Dean from Santa Fe Community College, Landon, presented earlier is something that we would like expanded across the board. And then certainly basic education skills and selection of high school students for success. We looked at a model like the Career Enrichment Center, which is an LPN program here in APS, to a model that actually makes the program more accessible and affordable for the state to increase in total number of outputs. Next slide, please. The second challenge that we looked at was, of course, increasing the output of registered nurses annually. And the recommendations along this challenge include diversifying clinical sites across the state to include other locations outside of hospitals, including long-term care facilities, including clinics, and of course, developing and implementing a master clinician, master teacher curriculum that helps create a pipeline of clinical placement oversight that helps us diversify where we can place RN students for their clinicals. So essentially creating a program that helps us increase the total number of clinical oversight professionals that we have across the state, because there's a ratio that must be adhered to, but also whenever someone within a healthcare facility takes on clinical students, then the number of patients that they can actually see is reduced. So of course, we need to be sure that there are enough of these master clinicians across the state so that we can meet the increased number of students that we would see if we were to double the total number of enrollment we can handle at post-secondary institutions. A recommendation was implement and standardize incentives for increasing clinical faculty in rural hospitals, clinics, and long-term care facilities. Implement the practice of LPN clinical placements in acute care and long-term care facilities. Establish a statewide fund that encourages rural clinical placements, and this is key, especially for critical access hospitals in New Mexico where there isn't a post-secondary institution nearby, or a lot of students, aren't encouraged to move or practice in remote locations. How might we support them by paying for their transportation or providing them lodging reimbursements to do these clinical placements in some of these more rural facilities? And then, of course, there was a recommendation to inventory where state appropriations are going now and whether or not existing appropriations could be restructured to achieve some of the recommendations that this committee came up with instead of investing additional dollars. Next slide, please. Third, increase RN program faculty recruitment and retention rates. And of course, salaries is the big issue here. How might we conduct a statewide assessment of existing faculty salaries and address the disparities by region? That means that if a more rural institution needs to pay more to keep faculty there, then how might we achieve that so that it doesn't appear as though more resources go to rural institutions? Conduct a statewide assessment to identify most common barriers to recruitment of faculty. Establish a pipeline program, of course, so that we can start growing faculty from secondary through post-secondary completion. And then, of course, create a network that facilitates RN faculty retention. How do we somehow pull faculty together in a more meaningful way so that they can work more collaboratively and essentially support each other as they become inclined to leave faculty as a profession. And lastly, on the next slide is challenge 4. And we look to see how we might increase RN retention, right? Because we know that it's very difficult at this point for the state of New Mexico to identify what we call level of effort for healthcare professionals. We know by licensure how many licensed professionals there are in the state of New Mexico, but it's very difficult for us to say of those licensed professionals, how many of them are actually working, how many of them are working full time and providing care. And if we can figure that out, then it's easier for us to determine what the true, what optimal demand looks like. So one of the recommendations was to establish an Office of Nursing Workforce at some state agency in the state of New Mexico to better understand what we need to do now and in the future to address the nursing shortage. Develop and implement LPN and RN internship and externship programs across the state, in addition to residency programs. And then, of course, work within the facilities to develop a culture of value for RNs and LPNs. Some of the feedback we received is, part of what happens when a new RN comes into a hospital, how does that hospital balance shifts and schedules so that new RN doesn't feel as though they're coming in, that they're going to find it difficult to balance their personal life and their professional life at the same time, where a lot of RNs might ultimately decide, well, I can make a pretty good living working just part-time and taking care of my family so that I don't actually have to struggle with balancing taking care of my family or providing for my family and being an RN. So that essentially, Mr. Chairman, is the work that we did, the recommendations that were developed from a very collaborative group, like Secretary Mccamley said, that involved, post-secondary public partners, and of course the private partners, in this case, mainly healthcare facilities and their director of nurses. So I'll stop there and open it up to any questions you or the committee may have.
And Mr. Chair, we were working on this pretty hard when the pandemic hit. And unfortunately, as you've heard me kind of talk personally to you at breakfast sometimes in the morning, we've been pretty much all unemployment all the time for the last 6 or 7 months. We are just finding the resources to be able to shift gears back into what we prefer to do, which is put people in jobs. And obviously the healthcare situation is going to be one of our greatest issues. Just long and short, we need to find a way to get more men into the profession. I say this to the folks in the building trades all the time with females. I think 83% of registered nurses in the state are females, and we need to let fellas know, hey, look, this is something that you can do too. It's a really good paying job where you're allowing yourself to really help your community. Secondly, we need to have kind of a better point organization at the state to help put all this stuff together so that we can really do a good job bringing the educators and the the employers together to really make this happen. And third, we do have a backlog of people who want to get into nursing. But like some of your earlier speakers pointed out, unless we can get the clinical opportunities for them, and the real issue, which is unless we can get and retain faculty, we're never going to be able to get as many classes as we need to really fill these positions. So we thank you very much for this opportunity and look forward to addressing any concerns or questions y'all might have. Thank you.
Thank you, Mr. Secretary. Just real quickly, are you proposing that your effort will continue in the future, or is it wrapped up now?
Yeah, Mr. Chair, we do want to continue it. Like I said, we were kind of gung-ho about this going into the legislative session last year, and then we hit the session and the pandemic, and it kind of derailed us a bit from not only this, but pretty much a lot of the other stuff we've had. We've been all unemployment all the time. But like I said, it's starting to be time for us to kind of shift gears back into getting people in, and we look forward to kind of trying to drive this again. We really want to make sure we're working with the nursing community, but there's an obvious need here. And like I said, it is the number one biggest skill need we have in the state of New Mexico.
And I just want to comment that the photograph about the first class at Santa Fe Community College to be getting their LPN as they finish high school, that did include several young men. So that may be the key there. If you get them early enough and really offer them a career field where there's unlimited opportunity, you may be able to attract a lot more.
Yeah, Mr. Chair, that actually, the whole gender thing, when I got into this gig, kind of started driving me a little crazy, because when you have 97% of registered trades apprentices are gentlemen and 83% of registered nurses are women, it doesn't make a lot of sense from an efficiency perspective. But also, if people are saying, hey, I have to do X because of my gender, it really limits New Mexicans' ability to look at their futures. And if some guys want to go into healthcare and some ladies want to go into construction, there should be nothing stopping them. But it's something that we really do have to address as a state.
Great. Well, thank you. Thank you all for the presentations. And we'll go now to committee questions, and we'll start with Senator Souls.
Thank you, Mr. Chairman, and I very much appreciate the presentation. I won't, but I probably could ask plenty of questions to take up the entire time. There was a whole lot there. I think the first question really is for Dean Landon and Jenny. How are you doing first? It's good to see you again.
Nice to hear your voice, Bill.
In Doña Ana County, we heard earlier that there's a shortage of 750 nurses right now. We just had a presentation that we are short statewide, 4,856 nurses, I think, which is a yearly need that we need to train new ones of somewhere around 1,200. I think you very clearly indicated the biggest problem, and I think Secretary Mccamley just indicated that we have a shortage, or we have people in the waiting line, in the queue to get into the nursing programs, and you very clearly indicated the problem is there's a lack of faculty. How do we fund more faculty positions? Is that something we do as a legislature? Is that something that the institutions, the community colleges, the universities need to fund? How do we fix that? That seems like the way upstream problem we've got to fix first before we do almost any of the other things on retaining nurses.
Right. Well, I think it's multifaceted in terms of the approach we can use, but I think, as we have seen historically with the expansion money, we haven't necessarily been able to use that money to increase enrollment because nursing education is very expensive. And so I think, yes, we need more faculty funds, and it needs to be specific. So I think the place to start is what, Deputy Secretary Cerna mentioned in his slides, have specific appropriations that are tracked, right? So that the data is shared with the legislature in terms of, we give the funding for X number of faculty for X number of colleges and universities, and then we want to see the outcome. And in order to continue that funding, we need to see that the enrollment has increased and that the money is being used for what it was supposed to be. I think that is the very first step, and that's the most clear-cut direction we can take right now in this crisis. Thanks for the question, Bill.
And thank you, Jenny. And Mr. Chair, I think what we want as legislators is how much money. It is incredibly expensive for our state to have a shortage of nurses. I mean, it's expensive literally in lives, but it's expensive in so many other ways when we have a shortage here. How much money do we need to allocate for faculty, for increasing faculty salaries to keep them, for attracting more faculty here? And does that money go to higher education specifically for this? Does it go directly to programs? How much money? I think some of the things we saw was, we're spending somewhere around $5 million of an increase to prepare more nurses. Does that need to be, instead of 5 million, 50 million? How much money do we need? Who gets it? I mean, I kind of want specifics if we're going to fix the problem, because not fixing the problem is expensive.
Right. So I think if you looked at the report and you saw that the clinical nurses tend to make about $70,000 a year, and my 9-month faculty only make, on the average, about $50,000 a year. And so for them to come close, and that means they need to work in the summertime. How I shifted that situation was we worked really hard with our administration to get more 12-month faculty. And that was the way that I could recruit. But even with that, my 12-month faculty make maybe 64,000. So it's still not enough. So I think if you multiply approximately 70, maybe even 80 for benefits and fringe costs, and you allocate and you say, okay, let's give $80,000 to every pre-licensure nursing program that, and you have qualifications. Maybe it's you say you have to have had a pass rate on the NCLEX of at least 80% for the last 3 years. I'm just making that up, but I'm making up 80%. But just in terms of requirements, what have your graduation rates been like? What have your retention rates been like? I think if we look at those, and then you basically give every program that is meeting those outcome measures to invest that $70,000 to start with, and we see what the results are. And I think that we will find that if we can put out more graduates with just that increase, then we can slowly look at increasing that. I've been asked for years, how do you add to your enrollment? I need more faculty.
And Mr. Chair and Jenny, thank you. I appreciate it. It seems like it's a relatively, when we're talking about the billions we have in our budget, and we're talking about a few $1 million to pay nursing faculty more and to have more nursing faculty, it seems like this is a no-brainer that we ought to be putting the money in there. And again, having a shortage of nurses is expensive for the state. As we put more on, they are all taxpayers. They are all building our communities. They're keeping us healthy, and all of the costs that come with not having those things. This seems like a good investment that, we ought to be paying them good salaries. And I think, how do we get the money from the legislature to those actual programs, not relying on the administration of each individual higher ed university to determine what they think they can get away with, or how low they can get faculty to get it just enough to get by. If we're really going to solve the problem, we've got to make investments in nursing faculty. The other things then become problems after we're turning out enough people trying to find clinical placements. Thank you, Mr. Chair. I'll end there. I have lots of others I could ask about education, but I'll let others do that. Thank you, sir.
Thank you, Senator Souls. Representative Ferrari, you're next.
Thank you, Mr. Chair. One question I have, as I was listening to Deborah Walker, and she was talking about the chief nurse position. How does that relate, do you think, to what was being talked about for the Office of Nursing under Workforce Solution? I don't know if Deborah wants to talk about that, or Secretary Mccamley.
Well, Deborah would love to talk about it. So, Mr. Chair, Representative, given the fiscal state of the state, I think the beginning point, I've reached a point in my career, I want it done versus studied and prolonged. So I think you get, by putting a chief nurse within the Secretary of Health's office and codify it and fund it, it will be a great start versus setting up an entire new office. The reality is that that individual can look at this landscape with all of the different issues that need to be addressed. So rather than a new office on nursing workforce, you can address the nurse residencies, you can address maldistribution, you can address rebuilding a backbone of public health nursing in the state. There are a range of things, and I believe that that's the starting point. If for some reason our revenues are such, then great. We'd love to have an office on nursing workforce, but I think it is an imperative to begin to address this now. And given all the multiple asks that face the legislature, the needs, the constraints potentially that you face in a virtual setting in 21, the nursing community would like to see that chief nursing officer for the state that has authority, that is funded. And if I could loop back for both you and the senator on questions on your program down in Las Cruces, you have a strong new dean down there at NMSU with vision and with the capability of bringing in great new faculty. So that is being rebuilt. The other tool that all of you have is there is a line item that is in the different nursing programs for capacity building. But you have to be careful and put in appropriate language so that those dollars are on top of the base and are not picked off by the administration. Those dollars need to stay with the program director and are on top of the baseline dollars that the legislature appropriates to the nursing programs. So you do have tools, you do have strong program directors and strong deans, but we are more than happy to work with you now so that what the senator's talking about and to address your question, Representative, what needs to happen. Thank you.
Thank you. Bill, did you want to say anything about it, Secretary Mccamley, or?
Thank you, Representative. Yeah, I don't think, and Ricky, jump in if you want to talk about this, but I think our issue was basically we need kind of one point someone at the state level to bring all this together. The issue we found is that the Board of Nursing seems to be really focused on standards rather than recruitment. And the problem with putting like an office about nursing in any one higher education sphere is that sometimes they're not trusted by other people or whatever. So, really trying to say, okay, we have one person here that can focus on all these different needs is really important. That being said, I agree with Ms. Landon that when the money goes in, I think it is important that it goes to where it's supposed to go to, which is really the faculty salaries. I think that's the one thing all three of us all three agencies on this panel can really agree on 1,000% is that the lack of, hey, let's say if you're going to make 55, 60 grand teaching and I can go make, 10, 15% more doing the thing that I'm trained to do, you might want to go do that. We see the same thing with like welding instructors as well at high schools and colleges. Ricky, did you want to kind of jump in on this one?
Mr. Chairman, Representative, no, that's accurate. I think leadership, is really the key here, right? There are a lot of issues. There's been a lot of recommendations. Who can serve as the state's leadership in bringing some of these things to fruition, and that is answering those questions like how much, when, how. All of those questions are critical.
Thank you. And thank you, Mr. Chair. I had one other question, and I wanted Ms. Walker to understand the safe harbor that, yes, we aren't giving up, but we do need more of the different groups and their support for the safe staffing and that increase. But I was also wondering if when we're training nurses, and this goes to Ms. Landon, that do we have education, incorporated into the nurses' curriculum, anything about such things as how safe staffing works and how they should be interested in that and talking to their employers or hospitals, how that should be?
It's been a while since I've looked at the details of the curriculum, but we do have a professional issues in nursing course. And I've worked with Deborah. I think that was probably when I first met Deborah, when she got me involved, and we started to send our nursing students with the New Mexico Nurses Association to the Roundhouse every year. And it became part of our curriculum. It is still a part of our curriculum. Deborah is involved in that. Linda Siegel gets involved and teaches the students what the process is for politics and bills and laws. And you're right, it's crucial, it's important. They need to know it before they get their license. And so I really am grateful to the New Mexico Nurses Association for helping us to integrate that into our curriculum. I can't, and Deborah can speak that we've seen nursing students come from all over the state for this day at the Roundhouse, and hopefully they have all integrated into their curriculum as well. But it is very individual, but it is certainly for our college a huge part of what the nursing students have to learn. Thank you.
Okay, thank you. That's all, Mr. Chair. Thank you.
Thank you, Representative. Next, we'll go to Representative Debbie Armstrong.
Thank you, Mr. Chair, and thank you, panel, for all that information. And Secretary Mccamley, since we don't have your slides yet, hope you get those to us so we can post it as handouts, as well as the full report that you did would be fabulous. Because I don't know that any of you were on, whether you were or weren't on this morning when I gave my little spiel, but I'll do it again to emphasize. We have endorsements on November 12th, and then we present what the committee's endorsed to LFC as recommendations in December. And so you need to get bills drafted, and even if it's the appropriations, if it's not already in budgets, in department budgets, simple appropriation bills, because it'll get folded in, but for whatever it's for. So as much help as you all can give to kind of formalize your request so that we can have something to endorse and recommend to LFC would be really helpful. And if you don't have sponsors yet, you don't have to worry about it too much. I know the senator and certainly myself are happy to open up files for you and get stuff drafted. So just presenting it here and say we need more money here or there has to work its way, as you know, into a bill. And if it's not in what we give to LFC, it's not going to be necessarily on the top of their list. So I would strongly encourage, get the numbers together, get it drafted in a bill and bring it back to us for, submit it back to us for endorsement. But Mr. Chair and panel, I think probably for Ms. Landon, how I'm interested in, and I just, for the record, I'm contributing my family. My youngest daughter will finish her RN BSN in December.
Congratulations.
So, thank you. Thank you. However, it wasn't all that easy to do the matriculation for, if she had started at a community college and then to UNM, even though she had a bachelor's in emergency medicine at UNM. So she went private school. So I have to ask and say, how easy is that transition from starting in the local community college and getting your BSN?
Thanks for that question. So what your family experienced is fairly common. And with the collaboration that occurred between the universities and the community colleges through NIMNIC made that process even more competitive. And there are a couple of things that happened at the same time. We know that the university, I'm sure MSU is this way, and I know UNM turns away many, many qualified applicants, like yours was, because they just didn't have enough spots. Ours was the same. I would say that before the collaborations and the MOUs where students could stay in their community college and attain that bachelor's degree, it was the transition and the matriculation from a community college to a university was much more challenging. Now, I will say though, if a person was able to get into an associate degree nursing program, there are programs in the state which are relatively easier to get into that are called RN to BSN programs. So that pathway is there, it's very well established, and they're pretty easy to get into. So it's really that RN route, and if you wanted to do a bachelor's RN route from the high school level, that's really challenging. And that is part of why I was inspired to create our LPN pathway at the high school level, because it broke my heart to see some of my friends' children grow up in Santa Fe, want to become nurses and stay in the community, but they could not compete. Their grade point average was not as competitive as those that might have been older, more experienced, and a lot of them college graduates. So I think that when we look at that issue, which is common throughout nationally, every year thousands and thousands of qualified applicants get turned away because there aren't enough faculty. But we can increase that pipeline and increase the assurance of that matriculation if we can expand our programs in our rural community colleges and have them partner with universities. And that's going to also help, not only will it help students through that pathway, but it's going to help keep our nurses in our rural communities as well. But it is an issue.
Thank you. And I do appreciate the working towards the higher degree, to the RN, to the BSN, et cetera. But, and probably some of you on the panel, my time in healthcare goes back 45 years, and there was, we had lots and lots of LPNs and really top-notch nurses, I think. And even in management positions that were LPNs. And I do think we may have lost something if we're not doing LPNs anymore. That gives an opportunity for people to get in nursing, get experience, and then as they're able to, along their career, pursue their RN and pursue then their bachelor BSN if they want and need to. So I think that's actually a great idea to have a pathway for LPNs, because you don't hardly see any anymore the way we used to. So I think that may be, one way we can expand, because then you can have, you don't necessarily, I would assume, have to have PhD nurses teaching your LPNs. You can have BSN nurses teaching your LPN. So you can expand the teaching staff as well. And, I think we also, and I don't know that this is part of what you do in nursing school anymore at all, but lots of nurses, as you know, peel off into healthcare careers that are not direct hands-on nursing anymore. Yeah, Deborah, and the same with me as a PT. I peeled off and not doing direct services, and but they are, that experience in healthcare makes for phenomenal managers and program people in all sorts of things besides direct care. So I don't know where I was going with that other than just so forgive me, just acknowledging that there's lots of nurses doing lots of things other than direct care. But thank you for everything. I know I had talked a little bit to Linda about the school nurses stuff. Let me know what you need to get drafted. Or Carrie, I'm happy to do it.
Thank you.
Okay. Thank you. So, and then next we need to get a nurse in the legislature. So just, start recruiting for 2 years from now.
We agree.
Thank you, Mr. Chair.
Thank you. I'm afraid the nurses make too much money in their profession. They can't afford to become legislators. So we'll go next to Representative Tara Lujan.
Thank you, Chair, and thank you, Representative Deb Armstrong. You actually touched on a lot of things I was thinking about with regard to our nurses and direct services and doing more administrative roles today as RNs and such. And I have had the background in healthcare. I've been a nurse's aide and a medical technician, surgical tech, and raised by an RN and many RNs here in Santa Fe. So as a nurse's daughter and being raised basically in a hospital setting and in healthcare as a background, I have a lot of concerns around this issue and have had a very vocal mother who was the labor president for her local 1199 for about 12 years. And she retired as at the School for the Deaf as a nurse there on campus. So I'm very proud of my mom. I'm very proud of my background because of my mother. So a couple of questions I have. One regarding we'll go to Secretary Mccamley. Mr. Secretary, when you had your task force and you talked about the setup that you had, and you talked primarily I guess primarily is what you said, with employers. I'm wondering, did you also include the workforce, the actual nurses and other providers that are actually doing the labor? And also, did you actually talk with labor itself? Because, we do have the labor unions in some of our hospitals and facilities.
So, Mr. Chair, Representative, I'm going to let Ricky Serna answer that question. I know we had the person that was actually helping put the report together was a nurse, but Ricky, you want to address that?
Yes, Mr. Chairman, Representative. So the sector strategy, and hopefully when you see the slides, you can see the model is a national model that really revolves around pulling together the public sector partners and the businesses or the employers, we'll call them. And in this case, of course, it was the providers. So there's a space, I think, that needs to be created to hear directly from practicing nurses or those who have left the profession for whatever reason, so we can better understand why that happened. But in the work that we did, it centralized around the public resources and associations that work to meet or close the supply-demand gap, and the employers, of course, who are namely employing registered nurses at this time. And the conversation isn't just about tell us what you need and we can go to work on a strategy for addressing that gap. The conversation is facilitated around how can you all as employers become part of the solutions so that there are additional resources and partners toward closing that gap. But I like the recommendation that at some point we should probably convene with RNs, RN students, those in programs, those aspiring, so that we can understand what the needs are from their perspective, and try and address whether it's affordability, preparation, or other barriers that we can help them overcome.
And Ms. Chair, Representative, I would also say that, in the course of these discussions, and I am fairly certain that Ms. Walker can probably bring you more up to date on this, but retention also has to be an issue. And we did definitely hear stories about burnout. We heard stories about abuse, frankly, and we also heard stories about the fact that a lot of hospitals and clinics are paying these traveling nurses to come in. In fact, it's funny. We were talking about this. My mom's friend Emery is coming down from Fort Collins, Colorado, to be a traveling nurse for 3 months here in Albuquerque, starting next month. And an interesting side effect of that is that the cost of bringing those folks in is really, really big. So when we can't fill the gaps that we have in our nursing positions here locally, the only situation seems to be able to bring in these other folks from outside the state, and then it ends up raising the costs of healthcare. So I think you're right. Those issues are persistent, and it's something that does kind of need to be addressed once we start putting a package together to kind of make the pathways for recruitment more clear.
Mr. Chair, Secretary, and Mr. Serna, thank you for that. But I really would implore you to have those conversations. Just now, I've been an HR director, so working in the workforce aspect as an administrator. And the heart of our nurses, the heart of our communities, are with our workforce that are actually doing the work. I acknowledge and I understand where you're going to get the information from our employers, but I think the greater good for us is to actually talk to our workers and see where they're coming from, and really integrate that into everything that you're addressing, because they are part of the conversation. And just I don't know if you're hearing secondhand about the burnout and abuse and the stories, and touching upon the traveling nurses that come in and actually do raise the costs of healthcare. It is a huge issue, and it's one that my mother worked very hard to create more community nurses and protect them through the labor union. So I'd really implore you to talk with them in your workforce and include them in the work that you're doing there. So thank you for your response, Mr. Chair, Mr. Secretary, and Mr. Serna. The next thing I wanted to ask was, I guess that kind of goes into that with Ms. Walker, Deborah Walker. You talked about the compacts and the contracts, and this goes into a bit of what our Mr. Secretary mentioned about our traveling nurses. And Mr. Chair, Ms. Walker, you talked about not getting that data, and I think earlier in an earlier committee that was discussed as well. And I don't understand, what the hardship is not being able to get the information of these types of contracts or compact workers. So I would support you on the efforts of getting that done. Like I said, any HR division should have that information and readily available for us to get that information. I don't know if it's more of a comment for me, but I appreciate you bringing that up because I did ask about that in a previous committee. So thank you, Mr. Chair, Ms. Walker. I think the next question I have is for Ms. Jenny Landon. So let's see. So I guess it goes back to what Representative Deborah Armstrong was talking about, and just the training of our. We're talking mostly about nurses and everything they're doing, and the quality there through our programs, and it's been addressed with me that a lot of our nurses, Mr. Chair, Ms. Landon, through the training when they actually go to work, and I don't know too much about this, but there's a lot of administrative training that's going on, and there's not a lot of focus or issues or education being given to the nurses aid, or what is the I guess, I'm sorry, I'm kind of going off on some of my head spinning on some of this information, but to continue education, is there like a plan with our nurses aides or LPNs and getting them to get a higher degree? And I know that you were talking a bit about it, Mr. Chair, Ms. Landon with Representative Armstrong about, how can we make that a little easier? And are you talking to our LPNs that are coming out of our high school programs to further their education?
Thank you for that question. So one of the projects that we're currently doing is a lot of the RN programs are integrating the LPN certificate so that the students, they're already nursing students, but they're able to get that certificate. And if they have to step out to work or work along the way, if they want to, while they're attaining their RN license. Some of the programs, and in fact, NIMNIC had, I think actually it was the Board of Nursing Education Advisory Committee, and Deborah might be able to refresh my memory, but at one point there was a statewide group, either through the Board of Nursing or NIMNIC, where we were actually looking at how do we apply credit for prior learning for LPNs who want to then enter the nursing program. So it is definitely an issue that we are trying to address at the state. One of the key elements of the LPN program at the high school, the model that we're using in Santa Fe, which we hope can be replicated across the state, is that by investing in these students to become LPNs, they have the opportunity to then have a pathway that's clearly designated as long as they have met the prerequisites, which a lot of their prerequisites are done at the high school level. For the college degree, they will be guaranteed a spot in the RN program. So I think that that's going to be huge. And then again, we do have LPNs coming back. I know that I believe CNM had quite the demand because they're in the city of LPNs coming in and trying to get into the nursing program. And so they were trying to work out a program in terms of how do we allow these LPNs who meet the prerequisites to maybe test out of some of the lower level courses and step into the program. So I think that there's effort across the state in looking at this issue that you speak of. We have a long ways to go, but I think because of the huge shortage of RNs in our state, I will say that one of the reasons we were encouraged to do this LPN track is because you heard it, where are the LPN programs going? But yet we're seeing an increased need. And when we started out this pilot, there was not this huge demand within our pocket of Santa Fe, but I saw across the state that there were these isolated, sometimes huge gaps in the need for LPNs. I also see LPNs as working closely with nurses. And so when we have that gap that can't be filled by the RN, at least we could have LPNs working with the nurses that are there to create a healthcare team that can cover those gaps. So our hospital in Santa Fe, Christus, when we said, we're going to need a place to do clinicals for our LPN students, they had one LPN who I actually knew at the hospital when we went to them about this program. And they said, you know what? We see the value in LPNs, and we're actually going to look at hiring more LPNs. And yes, we'll be a clinical site for your LPN students. So I think it's partnerships like that. Agencies are beginning to realize the value of LPNs and the partnership between LPNs and RNs. So I think we are trying to solve that gap in the problem. And we have a little ways to go, but there are changes that are occurring.
Mr. Chair, and thank you so much for that information. That is, I really appreciate it. And the reason why I bring it up is because there is a pay gap as well, as we're talking about from an LPN to an RN, and LPNs, as you're talking about, they're in this model in this circuit where you're recruiting. The recruitment has begun, and you're creating and recruiting from the community. And as we learned and we talked about in an earlier segment this morning, when you recruit from the community, you have a higher retention. And you are creating these community nurses, which I like to call them, because that's what my mother was, and her cohort here and she was a nurse at St. Vincent's with her friends, and they all started off as LPNs, and depending, but most of them actually went on to be RNs and some nurse practitioners, etc. But I'm asking this because of that, that pay gap, and so that if we can fulfill that need through creating more community service nurses, it supports the better outcomes, as I don't need to tell you, but the better outcomes, health outcomes for our communities and for everybody. So, Mr. Chair, Mrs. Landon, thank you for your time. Thank you for taking my questions, everybody, and I appreciate it. Thank you, Mr. Chair.
Thank you, Representative. And then finally, we have Representative Liz Thompson.
Thank you, Mr. Chair. Thank you all for such great information. Most of you probably know my mom was a nurse for forever. But I did carry the SunPath legislation, doctor-to-be, soon doctor-to-be, Landon. So can you just in a 2-minute rundown of what SunPath is and what NIMNIX is, just so that you can build up, so when I bring that bill in front of the committee, everybody will be jumping up and down and saying, let me on, let me on, let me on. So if you could just do a quick synopsis of what that is.
Wow. Okay. So SunPath it started out as a Department of Labor grant that Santa Fe Community College took the lead on getting a $15 million grant. And we were the lead school. We had, I think, about 10 other community college partners. And what we did over 4 years is we looked at the workforce need. And of course, we focused on healthcare. And what our deliverable for the grant was to take folks who were either displaced workers or underprepared, had not gotten their high school equivalency yet, and to be able to offer them this training hand in hand with basic math and English support that would expedite them through what should have been short-term certificates to get them out into the workforce. There were a lot of challenges and opportunities with the grant, but in the end, what we found is that for those who were successful, and many were, we took, and I'll just give you an example. We took a 1 semester, very intense EMT basic certificate course at Santa Fe Community College. And there were English and math prerequisites to that course. But we took a group of people who had not met those math and English requirements. And we created a 2-semester program because it was so intense. But during those two semesters, not only did they complete the certificate and pass the national licensure exam on the first time, they also were able to complete their English requirement. So it was a costly model because you have 2 teachers working in a content-driven atmosphere. But to take folks who are at a disadvantage or underprepared and see them being put into the workforce in an expedited manner was huge. And we found that the return on investment was phenomenal. That it was by far, we had people who were getting higher paid jobs and getting more jobs as a result of this. And so what Representative Thompson, and thank you very much, is trying to do is to make this a state model. We had hoped that it would be, but it is costly and we need to invest in it. But it would be an investment, and we like to say for many people it was a pathway out of poverty into meeting the workforce demands. So that's SunPath. And we used the NIMNIC model, the nursing model, as a template for how schools could come together and without having to replicate curriculum, to share them, and then to be able to, wherever they were in the state, have graduates supported by other colleges and what they were doing. So it was a true partnership. And so in many ways, it was very much like that NIMNIC statewide model. How'd I do, Representative Thompson?
I think you did great. And I'm sure everybody's going to line up to support this. So you did great. Thank you, Mr. Chair. That's all I had.
Thank you.
Thank you, Representative Thompson. And just checking, I don't see any other questions. I just wanted to bring up something that I thought would get mentioned and didn't, and that is that one of the bond issues on this year's ballot for university construction projects includes a $30 million new College of Nursing for UNM. And the article I read about it indicates that it will enable the university to double the size of their nursing program. And I wondered if anybody wanted to comment about that and whether that's going to require, are we going to have to hire away all the Santa Fe Community College faculty in order to fill the what do you think?
Oh boy, this is a really delicate matter. This is what I'm going to say. We have had partnerships with 2 universities in the state in terms of trying to expand our programs. And the numbers did not increase with either partnership. Now, we converted from having only associate degree students to having bachelor's degree students who also got their associate degree. So it was a win-win situation for us. And we all bought into the importance of having a bachelor's degree. And with the geographic distance, the community college had to work towards coming up with our own clinical sites for the university clinicals. And we did a lot of our own didactic courses that were university clinicals by our faculty who were hired by the university, or it was online. So classroom space at that time was not an issue. I would say the biggest barrier for us being able to expand were being able to pay faculty. So that's all I'll say.
Good. Anybody else? Deborah, did you want to say anything about it?
I was just going to say that Dean Casper has done a good job in promoting this, including on KOB, and loves to point out that current building is shared with pharmacy and used to be an old Coca-Cola bottling plant. So it is something that I think the nurses there at UNM feel very, very strongly about, to be able to increase their capacity. How it works within the NIMNIC piece, I honestly just don't know. I have not had that conversation with the dean. So, but right now in the day of COVID, it would be because everything is virtual still, other than clinicals.
Well, thank you. And thank you all for your presentation. Just one last comment, that is, I was on a Zoom meeting the other day where I was astounded to find out that the sum total of all the bachelor's level teachers graduated by the 5 university programs in this state was less than 100 for each of the last 4 years. So I know we have a shortage of nurses, but the shortage of teachers is every bit as serious, I would say.
Right.
Oh, okay, and I see we do have another question. Senator Antoinette Cedillo Lopez.
Thank you, Mr. Chair. This is just a little one. This was very, very helpful, and it made me feel good that there are so many programs about nurses, because when I was at the law school, it was much harder to get into the nursing school than it was the law school. when I had nursing students that ended up going to law school, all of them said law school was a piece of cake compared to what they've been through. And I just wondered if that's still true. I mean, because I'm obviously supporting the expansion, because it did seem that the doors were not as open as they should be at UNM. Do you have any comment on that?
Mr. Chair, was that to me?
To whoever wants to answer it.
Mr. Chair, Senator Cedillo Lopez, I would say that from the research that we've done, that yeah, that's an issue. And what you're seeing is there has to be so many faculty for so many students. So when you can't hire faculty, you can only bring in so many students to fill that. The second issue is the clinical sites. And this is one of the things that I believe Ms. Walker pointed out, that we really need school nurses in every school, and that we might be able to use schools for clinical sites as well. Those seem to be the two roadblocks that we have to be able to expand the amount of folks we can get into nursing programs. And I'm sure Dean Landon can expand on that all you want. But I think the one thing that did not get brought up, Mr. Chair, in this conversation that is very related to Senator Cedillo Lopez's comments is that if people want to be nurses, remember there's another option. You go to PEMA and you pay 3 or 4 times the amount of tuition to get a similar type of education. Some would say not as good. That's not my call. But that's the other problem we're having, is people are going way into student debt to be able to get this because of the backlog we have in our public institutes of higher education. So I would actually invite Dean Landon to kind of go more into that. But those are the two things that we're seeing.
Yeah, thank you for that. I would agree. I think that you're exactly right, Secretary Mccamley. We have, and I think that's part of the issue, right? We have students who can't get in, who are well qualified because we don't have enough faculty. They go to a private school, of which there are probably 5 in the state, and some of them even online. And you have a lot of debt, and so then you have to find the right job to pay off that debt, right? And it certainly is not nursing education. So it creates a vicious cycle that way. Now, I will, in reference to the rigor of nursing education, you're exactly right. I can't say it's harder than law school, but I don't know that I could have done what I did 35 years ago now, because as technology has changed, and the healthcare system, you know, I'm doing my PhD on nursing education within the state, and you know, in doing the research, and we look at how rapidly nursing education has changed, and how it needs to continue to change, and so much so, there's so much information, and what we found is that, you know, 30 years ago, I didn't have to memorize as much as I'd have to memorize now, because some of those diseases and illnesses didn't exist. So now we're like trying to pour in all the traditional information, plus everything new that's up and coming. And it's really challenging, so much challenging that there's this trend nationally. And this is what NIMNIC did. There is a trend to go from traditional memorize everything that you have to know to a concept-based curriculum, which is, let's talk about the concept of these disease processes. Because what we find is that, and I've heard this, and probably Secretary Mccamley may have heard this too, is that nurses need to be critical thinkers. And if we're just memorizing and we're stuck in a situation where our minds go blank, we can't critically think. And that's a problem, right? And so there has been this national trend because of exactly what you're saying, because of the rigor, because we can't just keep filling up our brains with information. There's not enough room. So it is a phenomenon that the rigor of nursing school is not going to go anywhere. It is going to be as rigorous, if not more so, with every change in healthcare. But we are coming up with ways to handle how to educate our nurses so that they don't quit nursing school, so that they're able to pass, and that we can retain them and graduate them. But that it is a challenge, and I have heard that time and time again too, as well.
Senator Cedillo Lopez, are you done?
I was on mute. Okay.
Yeah.
I just wanted to thank them for that offer and just offer that the law students that I had that had been nurses were amazing and they got their work done stat. And several of them are very prominent and excellent attorneys around the state.
That's great.
And yes, Representative Armstrong, did you have a question? Your hand's up. I didn't. I think she may just have left it up. So with that, we want to thank the members of the panel. It's been a very, very informative, very fascinating discussion. And we certainly look forward to any legislation you want to bring forward. We would, I think, be very, very receptive to the issues you've raised. Thank you for coming today.
Thank you. Thank you for your time.
Thank you, Mr. Chair.
Thank you, Mr. Secretary. And with that, we'll move now to building a pipeline for rural physicians and residencies in rural New Mexico. And we have another panel. This one is comprised of Jerry Harrison, Dr. Jerry Harrison, the Executive Director of New Mexico Health Resources, John Hummer, the President of the Burrell College of Osteopathic Medicine, and Dr. William Peratt, the Dean of Burrell. And we'll turn it over to you, Jerry. Why don't you lead us off? Or Dr. Hummer, whoever's going to do it.
Well, you're Mr. Chairman. I'll defer to you. You tell us, and we'll follow suit.
Let's take you in the order listed on the agenda then, and that's Jerry Harrison first, then Mr. Hummer, and then Dr. Peratt.
Thank you, Mr. Chairman. I am Jerry Harrison, Dr. Jerry Harrison. I'm the Executive Director of New Mexico Health Resources, and if I could ask to have my presentation put up, please. I'll try not to repeat a lot of the information that was discussed earlier in the day. I am the director of New Mexico Health Resources. It is a private, not-for-profit organization that was established in 1981, and it was specifically created to recruit health professionals to work in the hardest communities for which to find people to work. We were created as the result of a death. A man down near Lordsburg was on his roof, had a cardiac event, and there was no local care available to him. And three individuals, one at Press, one at the old Loveless, and one at UNM, started a movement to have us excuse me, I had an item on my screen that was not mine. To start a statewide recruitment organization, and we've continued continuously since 1981, and we find vacancies. That's probably the most important thing that we do in terms of our daily and weekly and monthly effort. We work directly with employers. They tell us the types of health professionals for which they are recruiting, and we put out a very, very broad statewide, national, and international effort to find employees, or at least candidates, to refer to them. Next slide, please. I'll deal with the recommendations at the end of this. What do we do for trainees and job seekers? In terms of the pipeline, we're both at the front end and the back end, and most of my comments are going to be directed toward physicians, since we're involved with some educators that educate physicians down in Las Cruces. we start out working with medical students typically in the first year. I think that we were scheduled to meet with the Burrell students when the pandemic hit, and our first meeting with the Burrell students was canceled. What we do for candidates who are looking for work, we refer them to the opportunities of which we are aware. We supply them with a lot of financial aid information. It is very interesting these days with highly educated young people. We still have to do a lot of career counseling, a lot of information about what are the various systems of care that are in the state. And we do a lot of work in terms of resume preparation and assistance, help them with interviewing, and then we read a lot of contract offers as well. Next slide, please. We do, on the flip side of things, we work with communities. The contract that we have with the state of New Mexico allows us to make referrals at no cost to New Mexico Department of Health funded clinics, Indian Health Services facilities, the 638 tribally operated clinics, and the critical access hospitals, and the few rural health centers that we have in the state. That totals to well over 100 clinical sites to which we are referring at any given time. We provide a lot of information around workforce to administrators, to people who are doing recruitment, people that work in HR. We spend a fair amount of money on advertising of positions that are available across the country. We run a couple websites, nmhr.org, and then we collaborate with the National Rural Recruitment and Retention Network with 49 other states, some tribal governments, and the Northern Mariana Islands to reach out, particularly for primary care. Our focus is mainly on primary care, and we do a lot of things jointly with other states. Next slide, please. Financial aid is a huge issue these days. As I said, we were going to focus on physicians. Dentists commonly come out of dental school with debt exceeding $650,000 now. Typically, even those with WICHE support are coming out with $500,000 of debt. Physicians, nationally, it's right around $200,000 of debt in the primary care professions. How do they finance that, particularly in primary care? In New Mexico, the National Health Service Corps provides a lot of financial support to young people coming into their first jobs. The state government through the Department of Health and through the Department of Higher Education supply not only loan for service, which was discussed this morning, but loan repayment. That's a different animal, and I'll get into that in a few moments. And then the other way, and it's self-financing. People run up a lot of debt to become educated, and there are not a lot of scholarships available in New Mexico to students in the professions that we deal with. And so a lot of people in training do incur a lot of debt. And a lot of that is even above and beyond education. Next slide, please. The first thing that we do when we have someone contact us is ask the question, where do you want to serve? We also ask, who do you want to serve? I've been director of New Mexico Health Resources for over 25 years, and virtually every community on this map, you'll find someone with whom we have worked to help them find a job, change a job, or might now be looking for another job. The state is attractive to a lot of candidates, and it's not. It is our job to sell communities, but the way we do it is we find people, we match them to opportunities, and we turn it over to the HR folks in those individual clinical sites to negotiate, for example, over a position, to describe the benefits, if you will. One of the things about the four of us that work at Health Resources, we've been in almost all of these communities. We've been in the clinic sites, we've been in the hospitals, we've been in the facilities, and that gives us a lot of power in dealing with candidates. Next slide, please. I'd like to take a couple minutes and talk about what's going on in the workforce, both nationally and in New Mexico. Our workload has doubled since March. The number of people looking for work across the country, the number of people looking for work here in New Mexico has been astounding to us. We see highly trained individuals. We see people with a lot of experience looking for work. At the same time, of course, the organizations that typically do the recruiting and will work quickly still have financial concerns. At this time of the year, we're typically aware of about 600 openings in the state among the organizations and the disciplines with which we work. And there should be about 400 physicians of which we're aware. I checked this morning, and we have 161 physician openings of which we are aware. Almost all of them, by the way, are primary care openings. I did want to say that the current situation has led to there being very few opportunities for nurse practitioners, physician assistants, and dental hygienists. The concern about financial viability among facilities is extremely strong, and it's something that we're going to look at for the future. Whenever there is a hot spot around the country, we will receive a lot of at least inquiry messages, or even candidates coming onto our websites and giving us their resumes and asking us to look for jobs. I think it's something that we need to be concerned about with our existing workforce, and whether or not they will, because of financial need, have to leave the state. And I do believe that we're going to have to invest in some efforts around retention of the existing workforce. Next slide, please. We're in a competitive arena. The shortage of physicians estimated by the AAMC is one that changes upon occasion, but still it's so severe across the country. It was nice to see that there's been changes in the ages of our physician population. It still is important for us to keep in mind that the shortage projected out to about 2030 is very significant in terms of numbers. How do we compete? The first question that physicians, that primary care physicians ask us when they contact us is, Is loan repayment available for this position? Is the National Health Service Corps functional in your state, and can we qualify for that? Do you have a state program for loan repayment? And we get to say yes. We do have the programs, but there are some issues with them that I'll get into. Next slide, please. One of the programs, and I'm not going to go in great detail on these, the New Mexico Health Service Corps was something that was established in about, I think it was 1994, 1995, several years ago. This pays a stipend to applicants that compete for it in these primary care disciplines. And the dollars have been sanded down year after year after year, and the program can really only support very few applicants at this point. One of the things about loan repayment or stipend programs or loan for service programs, there isn't one that fits every individual. Residents supplies a stipend in the last 2 years of their training. And for those that are really cash strapped, it's a dollar amount that is allocated to them. Next slide, please. The Department of Higher Education offers to, again, competing applicants a loan repayment program. It offers up to $30,000 in educational loan repayment for a 2-year service commitment in a shortage area. I believe that there are probably about 45, I don't have an exact number right now, but I think there are about 45 people serving obligations at this time of a whole variety of professions. And if there are questions about the details of this particular program, I'll answer them later. The disciplines are wide because of some of the funding that comes to the higher education department through the National Health Service Corps. Next slide, please. I bring up the National Health Service Corps, not that we in New Mexico have much say over it, but there were a couple things that I wanted to raise. One, it is the largest loan repayment program that we have active in the state, with about 250 participants at any given time, on any given day. Their contracts are a little bit more complicated than the state contracts, because if an applicant sees that they're going to, for example, be able to treat a lot of behavioral health patients with substance abuse disorders, the National Health Service Corps encourages them to apply to more than one loan repayment program. Next slide, please. So there is a standard loan repayment program, which is $50,000 for 2 years of service. That's $25,000. Just as the way the New Mexico program works, the payment is made to the lender, not to the individual. There is a new program, which is a substance abuse disorder loan repayment program, which is $75,000 for 3 years of service, and then a rural community loan repayment program for $100,000. We've had quite a few in the last round of National Health Service Corps applications of New Mexicans qualifying for the $100,000 amount. The reason that I bring this up is that the National Health Service Corps is attempting to diversify to kind of meet different needs rather than just the standard 25,000 a year. The second thing that I wanted to bring up about the National Health Service Corps, we're involved with a national longitudinal study of retention. The typical loan obligated health professional, and particularly physicians, remain in their first job for 28 months. They start looking for another job within 6 months. And the reason for that is that there's no guarantee for a second loan repayment contract. And if you're looking at $250,000 of debt, $500,000 of debt, and you have a family, you are going to start being concerned about making sure that come 2 years down the road that you're going to be in a job that if you don't get loan repayment, you're going to be able to pay off your debt. Now, the National Health Service Corps loan repayment program allows people to participate for 5 years of funding. But again, there's no promise because it's up to legislative approval. The same thing applies to the New Mexico Higher Education Loan Repayment Program. They're 2-year contracts. Historically, the state has extended renewal contracts to anyone who remains in a qualified site. However, I think that there would be an opportunity to do 3 or 5-year contracts. When we see physicians in particular that come to communities and have 3 or 5-year contracts, they tend to put down roots. Next slide, please. Hopefully these websites are still functional if you want to look at some detail with the various loan repayment sites. They were operative as of last Friday when I sent this in, but you can look at the actual programs on your own time. Next slide, please. I do have a few recommendations, and I need to say that I don't have the blessing of the Department of Health or the blessing of the Higher Education Department. These are things that I've thought a lot about over the last few years. When the Rural Primary Health Care Act was created, and I believe it was again back in the mid-1990s, maybe 91 and 92, the act didn't require that these professions be included as part of what is now our outreach effort. There are no dollars in our contract for recruiting social workers, behavioral health providers, or nursing. And I think it would be wise to take a look at that. There was a reason back in 1991, and that had mostly to do with there being a federal block grant that came to the state that was to cover behavioral health related disciplines. It was decided for whatever reason to just have the Rural Primary Health Care Act focus on primary care, if you will. I recommend restoring funding to the New Mexico Health Service Corps. I would also recommend additional money into the loan repayment program, and that there be some thought given to differentiating the programs around some of the needs that patients across the state exhibit to providers. And then also, there is no marketing of these programs. The Higher Education Department does not have funds or staff to market these programs out to potential participants. We do a lot of it on our own to make people aware. Also, this morning there was quite a bit of discussion about the tax credit program, and I have to admit that I was involved in writing a draft of that legislation. I'd like you to know that all of the professions that were mentioned this morning were included in the first proposal, and during the legislative process, I believe it was in about 2007, that the disciplines were diminished, if you will. I particularly look at licensed independent social workers as one of the professions that should be included in that for a couple of reasons. One, if there's a discussion about there are too many of them in rural New Mexico and we can't afford it, I took a look at the HRSA website on workforce. There are less than 200 LISWs in rural New Mexico currently. And the second reason is that they have the distinct ability among social workers to be able to bill for their clinics and for their services to Medicare. And that's an extremely, extremely important factor to any agency looking to hire folks, and they want to be able to keep them. I would include the other professions that were discussed this morning, but this one stands out to me. And thank you, Mr. Chairman.
Very good, Jerry. We'll come back to you with questions after the other panelists. So next, Mr. Hummer, we'll go to you.
Thank you, Mr. Chairman and members of the committee. It's an honor again and pleasure to be back with you all again. If you recall, the last couple of years we hosted you on site, and we look forward to a time in the future when we can do that again and be together in person. As I've done before, I just want to start off by recognizing all of you and thanking you for your service to the state. As I was listening to the presentation before this one, you deal with a lot of issues in these committee hearings, a lot of needs, a lot of wants, and it's a big task, big job. So we thank you for that. They don't pay you enough for what you do, but it is recognized, and we appreciate that. To Dr. Harrison, I want to commend you for your organization. Really enjoyed seeing your presentation, your slides. Dr. Pratt, our new dean, which I'll introduce in a moment, and I support your organization 100%. And once we can get through some of the COVID stuff, we'll get our students back in the queue with you as well on that. The topic today is pipeline development for rural track, and I think that when we talk about the rural track, what our objective today is, and I'm going to open up with some opening comments, and I'm going to introduce Dr. Pratt to you all, and he's going to go into a little bit more detail on an update as to where we're at as a medical school, because how BCOM, how we do as an organization, as a medical school, is a direct correlation to the supply chain, if you will, and to the integration into the rural placements throughout the state and the initiatives that we're working on, primarily to educate, train, and graduate medical students from our medical school. And by doing that, national averages state that regardless of whether they do a residency if they go out of state for the residency, at a minimum, on average, 35% of the graduates will come back to the state in which they went to medical school. And you've heard the numbers that if they do a residency within a 100-mile radius in the state or the region, there's a 65 to 70% chance that they will stay in the area. So Dr. Pratt will talk more details and update you on where we're at with our residencies, facilitating the development of new residencies, and about our graduation of our first class. Because believe it or not, we just started our 5th class, which is hard to believe. The development started in 2013, 7 years ago. We graduated our first class this last May. And Dr. Pratt will talk a little bit more details about those first graduates in our state. I've never felt more optimistic about the solutions for our state being here now going on 21 years. I'm pleased to report that we really feel good about our working relationship with UNM. I think there was always questions, being new to the sandbox, if you will, how we would get along. But I'm pleased to say that I think we're getting along very well. And we're working on some joint issues. And I think that's good for the state. And you have two homegrown medical schools, one in the north, one in the south, focused on improving the health and well-being of our state. And I've never been more optimistic, as I am now, because there are solutions, and we'll talk about those and ways to really move the needle in a very strong and positive direction. One thing I wrote down as I listened to Dr. Harrison's presentation, he mentioned about the absence of scholarships, which is so true. But one of the things I wanted to update the committee on is that, and we talked about this in the past when we hosted you, we have the benefit, even though we're a tax-paying entity as a medical school to the state, we're not tax exempt. We have a supporting foundation called the Southwest Foundation for Osteopathic Education and Research. It was the former New Mexico Osteopathic Foundation that was reconstituted, took on a new name, but it has been raising funds. We have a seat at the board. It's majority independent, but the IRS approved the charter to raise funds for scholarships for students that go to the Burrell College or research that's done at the Burrell College. This last 2 years, we've raised over $3.5 million of private philanthropy and scholarships. A family of means donated and committed to over $3 million in scholarships for students so long as they did their clinical rotations in southeast rural towns of New Mexico, Artesia, Roswell, Carlsbad, Hobbs. In that group, we have 4 students that are on full ride scholarships. That's about a $210,000 value per student. They won the lottery, if you will. They were ecstatic. And we have 8 students that are on partial scholarships that are half or a quarter, which is still tremendous support on that. And we're building that foundation as well. But I wanted to touch on that's one thing that it's a small amount in the number of doctors needed, but it's more than zero and it's growing. And so we're going to be building that over time as well. In any questions, I can come back to that in the Q&A on that. One of the things that to address rural New Mexico, when we talk about pipeline, you got to fill the pipeline. And so legislation and financial support to grow the pipeline. The pipeline is being grown by the medical students from UNM and from the Burrell College on that. And as great as the need is, it's not as simple as saying, okay, well, let's bring in another medical school from out of state to maybe open another location, because you can't increase the pipeline without connecting the dots with the clinical rotations and the GME and the residency. And Dr. Pratt's going to talk about that in a second. And there's some legislation that we're going to introduce that we've been working with our stakeholder groups, the hospitals, the medical association, about supporting that concept in support of protecting the clinical rotations to support New Mexico-based medical schools. And we'll come back to that later on that. The last thing I'd like to do before I introduce Dr. Pratt, I'm guilty of being accused of being a broken record, but the last several meetings that we've had as a group, I've said that it's been said before that, the federal budget, and I would say the state budget is the same thing, is an annual letter to God. And it's a letter that lists the priorities. And the priorities list the values, I would say, in order of priority. And I'm biased, obviously being in the healthcare arena, but I think I'm on solid ground to state that an investment of state dollars into, be it nursing positions, which you heard earlier, physicians, nurse practitioners, is one of the best return on investments that you can make as a legislator in this state. because not only is it job creation, but it goes beyond job creation. It talks about increasing mortality, decreasing the mortality rate, increasing health and wellness in our state as well. And this report here, which I'm sure if you guys, you've had copies of it, this is the report that was done on House Bill 480. And I do want, and I don't do it enough, and I want to recognize our government affairs individual, Pilar Faulkner. Pilar, actually several years ago, we met with her and said we wanted her to help, take the lead on increasing GME funding development, because our accreditor holds us accountable. We have to demonstrate that we are working in the field to facilitate hospitals, legislators to increase new positions, funding for new positions on that. And she reached out, she got the sponsors for the bill, she worked on the bill. And I just want to recognize her and thank her for her work, and thank everybody on this committee, because it was a unanimous 100% voted bill, both bipartisan bill that passed on that. But in this report about House Bill 480 on the graduate medical education, I just want to read one section, just one section, because I think it says a lot, and it's worth me reading. Investment in the primary care physician workforce yields significant returns for both local economies and population health. For example, each physician annually supports 3.2 million in output, an average of 17.07 jobs, approximately 1.4 million in total wages and benefits, and $126,000 in state and local tax revenues. It goes on to state, again, the increase in health status, the decrease in the mortality rate, and the decrease in ER visits, the cost savings, which is just exponential compounded savings. So on a budget issue, when you're looking at the GME investment dollars, additional money in that, the loan for service forgiveness, I don't know of any other incentive in the state, and with all due respect to other industries, the hemp industry, the other industries, film and all that, they all have their rationale and their reasoning, but I don't think anything even provides the impact that an investment in the physician, the nursing, nurse practitioner, dental workforce does for communities and for the state on that. At this time, I'm going to introduce our new dean, Dr. Pratt. And what's great about Dr. Pratt, he was among 15 finalists through our search committee that was made up of our faculty and staff. He rose to the top. He is a rural physician. He'll talk about his background. He came out of Central Texas. He came from the Texas A&M University Medical School. He grew up in rural America around farming and ranching. He worked in rural America as a rural physician. He went into academia, and we are pleased to have him in our state, and his wife as well, joining our community in Las Cruces. And with that, I'll introduce Bill Pratt, and he'll give you an update on BCOM. Thank you.
Thank you, President Hummer, and thank you, Chairman Ortiz-Pino and members of the committee for making time for us today. I'm sure it's been a long day, and I appreciate your patience in bearing with us here. Just an update, as President Hummer mentioned, we were pleased to graduate our inaugural class this past spring. And if you would just think about the course of training to become a physician, it's 4 years of medical school, that following undergraduate education, 4 years of medical school, and then anywhere from 3 to 7 years of residency training in a student's or graduate's chosen specialty. We were very pleased that we had 100% successful placement of our graduates into graduate medical education programs or residencies. Personally, I can tell you that that is extremely impressive for any school, much less a new school graduating its first class. I think one of the worst things that we can do is try and educate a student, but also saddle them with about $200,000 of debt, graduate them with a DO degree, and then they're unable to secure a residency spot to further their training and get licensed to practice medicine. So again, 100% placement in GME And of that, we actually saw 70% of our graduates go into programs in either primary care, psychiatry, or OB-GYN. Primary care including all of internal medicine, family medicine, and pediatrics. Talking about how to get physicians to practice in New Mexico, how to retain physicians in the region, in rural areas. We had a quarter of our graduates stay in the region to continue residency training in either New Mexico, Arizona, or El Paso. We had about 10% of our class made up of New Mexico residents. And so we feel like that's a good place to start. We look forward to building on that. I can tell you, as President Hummer said, my past, I practiced internal medicine for 25 years. About half of that was in a rural town in Texas of about 5,000 people before I transitioned to a larger area in an academic role. And really the best way to get physicians practicing in rural America is to get them to train in rural America and to bond with the patients that they're seeing. They bond with the physicians that they're training under, and they really start to grow those roots that Dr. Harrison mentioned. So it gives us a good starting point. As I mentioned, we look forward to improving this. If I may, one of the challenges that we face, and it's, I think, a challenge for, as I heard the nurses mention as well, but in order to educate a newly degreed physician, it takes physician teachers and supervisors, or what we call preceptors. And so those preceptor resources are precious because it's hard to get students into a rural environment to train when there's already a shortage of physicians in those environments to train them. And so it is a growth process. It is a multi-step process. We have, I believe we're doing a good job, both Burrell and UNM, in educating students and graduating newly degreed DOs and MDs. And then the point becomes expanding GME, or graduate medical education, growing those residency programs. For context, in numbers that may be a couple of years old now, New Mexico has residency training spots that train about 0.5% of the nation's physicians. So we're not exactly blessed with GME, but I will say we are fortunate in that we have partnered with some of our clinical affiliates in the state to expand GME. As President Hummer mentioned, House Bill 480, that provided some provisions for GME expansion. And as an example, just here in Las Cruces, we have 2 clinical affiliate systems. One has a family medicine residency program and a pharmacy doctorate program. The other has internal medicine residents, as well as osteopathic manipulative medicine residents and orthopedic surgery residents. And those 2 affiliates account for 83 GME positions, which is phenomenal, I think, for an area this size. And so while we want to grow GME, we want to continue to educate our students, retain them in New Mexico in training programs so that they end up practicing in New Mexico and benefiting the citizens of New Mexico. We want to provide structure and control for that expansion so that we don't create bottlenecks or we don't misuse physician preceptor resources. And so, as President Hummer mentioned, one of the things that we're looking to do in partnership with some of our stakeholders is to contribute toward legislation that provides some structure for expansion, that helps the medical schools and the GME programs, and also helps protect all of us, New Mexico as a whole, from any predatory school that may want to come in and secure physician training resources for its students and then export those students out of state into other training programs, which obviously diminishes our opportunities to retain those physicians and to train those physicians as residents. So I don't want to ramble. I know it's been kind of a long day. I'll pause and just open things up for questions, if I may.
Dr. Carrett, thank you very much. And we do have a number of committee members with questions. So we'll start and just go right down the line. Representative Thompson, you're first.
Thank you, Mr. Chair, and thank you all for your presentation. I can't remember who said it when they said that. I love the chairs that this is the Health and Human Suffering Committee, because we hear it. I have to tell you, this week is a lot less, or this meeting is a lot less serious, I won't say serious, sad than the one we had last time, which was child abuse and domestic abuse and rape and trafficking. And so this isn't quite there, but we do take on some of the big problems. And I guess my only question is, can any of you talk a little bit about what your plans are to get the GME, to where are we going to get the, we've heard for years and years on this committee that there just are not the sites for residencies, et cetera, et cetera. So, and that's been a concern of mine for a long time. So can you just talk a little bit about how we are gonna address that concern?
Yeah, let me kind of give a little background, and then I'll let Dr. Pratt add some color to it. Mr. Chairman and Representative Thompson, thank you for your question. The two current additional developments that we are looking at is, well, one, there's a new residency that just started its first class up in Gallup with Rehoboth. So that one just started. We are also, we've been working, we have full-time staff at our medical school that work with our clinical affiliates. So Dr. Hayes, that you've met in previous meetings as well, has been working with Memorial to do a residency family practice in Alamogordo. It's called the 1+2. The first year they're at Memorial, so Memorial would expand, and then the next 2 years would be in Alamogordo. And then there's a 1+2 program that we're looking at in Artesia. That's early in the development, and we're getting private philanthropy funds to help support that as well. When you look at 480, there's a mechanism where funding can come from the state, from the funds that the state allocates. It can be leveraged with Medicaid through Dr. Scrace efforts, and also can be leveraged with private philanthropy on that. So those are two rural areas that are being developed right now on that. And I'll stop there and let Dr. Pratt, if he wants to add any additional on that.
Thank you, President Hummer. And thank you, Representative Thompson, for the question. I think that the rural expansion is something that's very promising. The 1+2 program that President Hummer referred to basically takes a graduated MD or DO student, trains them for their internship year in a larger center, in this case, Memorial Medical Center here in Las Cruces. And then they spend the second and third years of residency in a rural facility, rural community. And in this case, we have that happening in Alamogordo and in Silver City, and the new program in Gallup. There's also potential for expansion into other areas, as President Hummer mentioned. So that is one way to expand primary care. The other is can be a little more challenging in that some of these affiliated systems if they already have graduate programs, then they're capped. They can only add so many spots. So that leaves the opportunity to create new programs in clinical affiliates who may be what we call GME naive. They've never had residency programs before. And for instance, the Mountain View Regional Medical Center here in Las Cruces was GME naive and has partnered with Burrell to to create GME positions and has a very robust program now. So those are the two main opportunities, either expanding existing programs or creating new programs. And then either of those can develop these rural outreach residency tracks to increase the resources and the likelihood of residents remaining in rural practices.
And Dr. Pratt, if I could just add Secretary Thompson to one other development that does benefit our state, and even though it's right across the border in El Paso, we've also worked to facilitate the increase of new residencies, primary care residencies as well in El Paso. And given that our students that are educated their first 2 years in Las Cruces, they do their rotations in El Paso, they're exposed to New Mexico, they have the relationship with New Mexico, then the idea is to boomerang them back. So the state of New Mexico has a better opportunity to recruit those residents being right across the border in El Paso than if they were in LA. So it does benefit us right across the border there, being in close proximity as well.
Okay, and then just, Mr. Chair, just to follow up on that, how big are your graduating classes and how many residencies have you initiated, and what is happening to I'm guessing that you haven't created enough residencies for all of your graduates, so what happens to the rest of them?
I'll be happy to take that. So our inaugural class graduated 133 students. Our existing classes are slated for between 150 and 162 students. Some of those students, we do have a pretty low attrition rate, and they may not actually complete the 4 years and graduate. Other students within a class may end up in another class behind them for whether it be a medical leave or academic leave, so forth. You're right. In graduating 133 graduates, we have not created 133 residency positions. Part of the challenge in creating GME positions is that the funding is primarily tied to Medicare and Medicaid as well as VA funding. And so it is a little bit of a challenge to fund, X number, and certainly you don't want to outpace, the growth of that program beyond a facility's ability to train those residents. And there we're back to the clinical resources of the physicians that are already on the staff that are going to serve to train those physicians. One physician can supervise up to 4 residents, which is a great help in dealing with our workforce shortage. But 1 physician to 4 residents is not a great ratio if you're trying to expand GME. You can only expand it at the rate that your precepting physicians are able to supervise those training physicians. And so that's one of the reasons that we're trying to grow and structure that growth so that we grow things at the appropriate rate, so that we don't want to compromise care, we don't want to compromise training. And so we want to create some structure by which we can all follow guidelines to optimize the training environment.
And Dr. Pratt, if I could add on to Dr. Pratt's comments, is that when you look at GME, it's really a national program. When you look at GME, our medical school is no different than a lot of medical schools throughout the United States, in that there's not a one-to-one residency creation for number of graduates. If you went, for example, if you looked at the roster of all the residents at UNM and you looked at all the programs at UNM, you will see medical students from all over the country that go to UNM. And if you went to other residency programs throughout the United States, you would see UNM graduates at those programs. The goal is to incrementally develop and build more additional programs locally to increase the probability of retention in the region on that. But again, remember my statistic that I used at the beginning. Even if every student left, which again, it's a free match system, it's a national system, 35% will come back on average to the region where they graduated from, which is better than 0 by not having that class. And there's 6,000 graduates that come from the Caribbean medical schools. With all due respect to the Caribbean medical schools, they are taking U.S. medical students' positions. Those, you've seen a downward trend in those match rates, and you've seen an increase in match rates. 99% of DO students match nationally in U.S. GME programs in the United States.
Mr. Chairman, may I make a comment?
Please, Jerry, go ahead.
We've not had the opportunity yet because there have not been Burrell graduates that have gone on to complete residencies. And I need to disclose that I'm on the GME Executive Committee at UNM. One of the things that we do is, as health resources, we try to stay in touch with many of those students that have left the state for residency. So back when we were able to travel, and occasionally I would run into the chairman of this committee in an airport when I was on a recruiting trip. We'd like to be able to do that with the Burrell graduates. We work closely with the alumni association of the UNM School of Medicine, and we kind of track our travel with where there are New Mexico residents in training. So we can bring, I think we can bring a few more back.
Thank you, Mr. Chair, and hopefully this will be my last one. It's kind of a two-parter, and one of them is just for my curiosity. So a DO resident, do they have to be supervised, for lack of a better word, by a DO, or is there crossover? And then the second part of my question is, are you looking at anything we can do legislatively to help you? And that's all I have, Mr. Chair.
Thank you again, Representative Thompson, for the question. Excellent question. So fortunately, in the GME world, the training environment does not require a DO physician to supervise a DO resident and MD to MD. That was the case way back. But for instance, even when I trained in the 90s, I had both MD and DO physicians who supervised me as a DO graduate. So the accrediting body for residencies is the ACGME, and that accredits residency training programs that train both DO and MD graduates. And so there's not a one-to-one. As far as support, I appreciate you asking. We are working with our stakeholders so that we would like to contribute to some draft legislation that would provide for a structure for any entity that wants to educate its medical students in New Mexico, that would require any institution that puts its medical students in New Mexico for training would need to be able to demonstrate the ability to expand and create GME slots, so that those students are not just taking up resources. That institution would need to also help create GME slots, so that, again, we don't upset the delicate balance of this system. So that's the heart of the matter, is just sort of resource management, so that we are good stewards of our training resources.
Thank you, Mr. Chair. That's all I have.
Mr. Chairman and Representative Thompson, I'd be remiss if I didn't ask, one other thing. It's not an ask, but just kind of plant a seed, because I know I've talked to Senator John Arthur Smith, and I know that he's in transition, but this would be the dreaded earmark. But we pay about $2.5 million in taxes a year to the state. If there was ever a carve out to take what we pay to the state in taxes and put it into health and human services, be it for GME, loan for forgiveness, whatever the case may be. If anybody wants to take that on, talk to Pilar. We'd love that. I think if there was ever an exception, There's so many other incentives out there and people that get benefits for different things. Take our tax money and put it to scholarships and put it towards GME development.
Thank you, Mr. Hummer. And thank you, Representative. Senator Michael Pavia.
Thank you, Mr. Chairman. As it turns out, Representative Thompson actually asked the exact questions I was going to ask, and I just am very thankful for the work that Burrell is doing. I think it's really revolutionizing some really good stuff for us. But I got my answers when Representative Thompson took the floor. Thank you, Mr. Chairman.
Thank you, Senator. Senator Bill Schultz.
Thank you, Mr. Chairman. And Mr. Hummer and Dr. Pratt, it's great having you, and being from Las Cruces, Burrell has been such a wonderful partner here in Las Cruces, just as community members, but also helping to meet our health needs in the community, and all the volunteer hours that the students have put in, helping with all the things dealing with the COVID crisis and stuff. Yeah, just wonderful partners here in Las Cruces. So we appreciate you very much. You had mentioned, and I think this is what you're talking about outside entities coming, is, for lack of a better word, coming in and poaching our residency placements. How do we better control those in New Mexico? What can we as a legislature do to help make sure that those residencies are available for the students who are more likely to stay here, rather than outside entities that aren't paying their fair share and are kind of poaching our residency opportunities?
Mr. Chairman, Representative Souls, thank you for that question. Let me just give you my perspective on it, and I'll turn it back over to Dr. Pratt. It's really the issue of out-of-state medical schools being a deliberate attempt to encroach upon the clinical clerkship rotations years 3 and 4, which is really the delicate asset for education training leading up to GME. What the legislation that you all are going to see is that if someone is going to try to come into the state, they would have to demonstrate that they have the support of the hospital systems, the clinical affiliates, which both UNM and BCOM do have. If they don't have that, then they shouldn't be able to come in and take those clerkship positions. And what Dr. Pratt was saying is that they would have to demonstrate, like we have, that you would have to create X number of new GME positions before you would come into the state. You just can't come in, take up these clerkship positions, and take your students in elsewhere on that. I'll let Dr. Pratt speak to it as well, and hopefully that added some clarification to it.
Yes, sir. Thank you. And again, a good question. I appreciate the chance to clarify. The residency training programs will participate in a nationwide match, and they will rank their preferences of graduates according to the graduate performed either in a training rotation in their hospital or in an interview. As President Hummer mentioned, the biggest risk really comes from this explosion of medical schools across the country. And even having come from my previous institution at Texas A&M, nationwide, the biggest challenge in educating medical students is in securing clinical training and clerkships. And in the case of GME and those clerkships that train medical students, oftentimes it's the same positions. And so the real risk is for what I would call a predatory medical school coming in from out of state, trying to place its students in a healthcare facility and having students trained by New Mexico physicians, and then those students graduate from school and go off to other training programs in other states. And so the real threat is in those medical schools using up New Mexico physician teaching resources. And so my big ask, our big ask, is really for the committee to consider endorsing the legislation that we are working to draft that would limit the ability for out-of-state medical schools to put their students here in training unless they're going to also participate in expanding GME training opportunities too.
And if I could add to that real quick, is really the legislation that are working with the Hospital Association, the New Mexico Medical Society, is really asking any medical school to do what we did. When we developed the medical school back in 2013-14, we first asked the clinical affiliates, the hospitals, do you support another medical school? If they would have said no, we wouldn't have been here. So we had clinical affiliation agreements to start with. And then we developed GME on that. So really it's really a blueprint saying, if you want to come in here, you've got to be able to demonstrate that there's a need versus just announcing you're coming in and not actually doing the due diligence and having the agreements in hand with the hospitals in the state. And so that's what you'll see when it comes forward.
And Mr. Chair, and thank you. I appreciate that, because I think that's the real concern is in New Mexico, we don't want a predatory medical school, using your terminology, to come in and take the resources where we're trying to train people that are more likely to stay here in New Mexico. And so if that legislation is necessary for us to be able to control that, please make sure that it gets drafted early and has a chance for this committee to review it, to get a committee recommendation for it. Because I think that's an important thing. Is all day we've been hearing about the shortage of medical providers in New Mexico, and certainly this is where we're growing our own, and we need to make sure that we don't have people come in and poach or predatory in using our resources to promote theirs. So thank you very much, both of you, and I appreciate it.
Thank you.
Thank you, Senator Souls. Next, we have Senator Antoinette Cedillo-Lopez. It's your turn.
Thank you, Mr. Chair. I just have a quick question. What does it cost to attend your medical school, and what is the average student loan debt that a student graduates with, and how does this compare to UNM's?
Mr. Chairman, Representative Cedillo-Lopez, excellent question. We get asked this question a lot, and I always like to preface before I get to the answer to kind of give a little background. We are a private medical school. When you look at the osteopathic medical schools in the United States, 80% of those medical schools are private, not-for-profit medical schools. There are 4 tax-paying medical schools, aka for-profit medical schools. There's 2 MD for-profit medical schools. We are ranked right at or below the median tuition of all private osteopathic medical schools. Our tuition is $53,000. If you went to went to Phoenix, there's an osteopathic private not-for-profit that charges $68,000. That's great. I've always said we could charge $68,000 and we could probably get it because the demand is so high for students wanting to go to medical school. But our philosophy is, the way we were founded, is kind of twofold. One is, how much is enough? $68,000 to us is way too much. Yeah, we would make more financially off of that, but that doesn't help our mission. Our mission is to recruit underrepresented minority students, which we are number 2 in the nation among all DO medical schools. We're in the top 5 in the nation among all MD DO medical schools. And it's our way to keep that tuition at the median while building that scholarship that I talked to you about through our supporting foundation is a strategy to make it more cost effective. It's still expensive. As I've said before, UNM is about, I would say, $25,000, but all of us taxpayers, we're paying the difference in the tuition. We're subsidizing that tuition, which is fine. That's fine. If they didn't have the taxpayer subsidy, that tuition would be much higher at UNM on that. So the average debt, we're right in line with national averages, like $230,000. Dr. Pratt may have another number on that. And that's why we really encourage our students. I get counseled about the National Health Corps, about looking at loan for forgiveness programs. And that's why the more we can do on those type of things within the state will increase the retention of those as well. But we run them very efficiently. We don't have an airplane. We'll never have an airplane as long as I'm there. We don't need an airplane. Just add, all you do if you had an airplane, you increase tuition. I mean, that's how we think. Any unnecessary cost is an increase in tuition to the student. And we just don't believe in that.
Can you envision a situation where you would be so fully subsidized that your students wouldn't pay tuition and you'd end up getting students and preparing them for what they love, not what it requires to pay their student debt?
we have a full-time development officer. We are welcome, and we would take a benefactor tomorrow that would come in and just put a $150 million endowment and convert the medical school to where we need $35 million, probably more than 150. We need about $35 million a year to cover, the cost from the tuition. Yeah.
Yeah, Princeton is like that. Any student who gets in, if they can't afford it, they get a free ride.
And that's what was so neat about the benefactor, that he's anonymous, but it's a small state. He's from the oil patch, but I mean, $3.5 million. And his whole thing was, I just want to help bring more physicians and keep them in Southeast New Mexico. And those are the kind of people we're looking for. And it's kind of cool. I mean, you should have seen the look on these kids' eyes when they got those full ride scholarships. I mean, it was a tearjerker,
It opens doors for them, because then they can do what they want instead of, what they're passionate about, instead of what pays the most money for their student loans.
Exactly.
Thank you, Mr. Chair.
Thank you, Senator. And let's see, have I missed anybody? Has everybody with a question been? Yeah, I think so. So I have a question. Oh, no, Representative Bash, you have a question.
Yes, I signed up kind of late, but I would like to ask about the New Mexico Health Professional Loan Repayment Program, and how much, does anyone know how much that costs the state a year for that program?
Jerry Harrison, you have the answer?
I only know what is allocated to those that participate. I don't know that. Well, let me make it a little bit more complicated. The award amount can be up to $30,000. And that is for 2 years. Each year that is paid. And I think I said that there are probably about 45 people participating. Not all of them have debt that gets them the $30,000 or the $25,000. So the state has the ability to fund a number of professions, and I don't know what the mixture of those professions are. The from higher education department would have to tell you that. But if you took, say, everybody got the $30,000, which they did not, times 45, that would be a lot of money that the state is investing. And this is separate from the loan for service programs, which is financially need-based. And I can see if I can get an answer to that and get it to the chair.
Secretary Pino, Chairman Pino, with your permission, if we could yield to our government affairs, Pilar Faulkner, she'll kind of give a quick synopsis of what's in the legislation and the money that's being requested for the program for loan for service. Pilar?
Pilar?
I surprise her. She's on mute. She'll get off mute here. Oh, I guess she doesn't have the control. So basically, she just texted me. It's basically this legislation is $400,000 is what is in the proposed loan forgiveness for service program that you're going to see in the legislation. Additional $400,000.
Excuse me, Mr. Chair, is that for the 2 years? Is that for a 2-year program?
Well, actually, we're trying to build the bank each year. That's been the goal. Increase it annually by adding money as non-reoccurring funds. And, we would just encourage the support of the committee to support compounding contribution into the bank, if you will, because our goal is to build it over time. And if each year we build it, and after 10 years from now we look back and we see how much money's there, and just continually increase it based on the availability of funds.
Yeah, I was wondering about trying to increase it to 3 or 4 years.
Oh, as far as forgiveness timeframe?
Yes.
I do not know if the legislation calls on that or not. Is anybody, can somebody unmute Pilar or not?
Mr. Chair, this is Jerry.
Yes, Jerry.
I can outline what the traditional loan for service program, because I think we're mixing, at least I may have contributed to some misunderstanding. The traditional loan for service program is a financially need-based program that's run through each admissions office for a variety of health professions. For physicians, the current program offers, and it is not need-based, it's $25,000 a year for 4 years in exchange for 3 years of service. If you're looking at having the higher education department manage it through the way that it is administered right now.
It's a completely different program.
Okay, Pilar, you're off. You're on.
Oh, so from what I understand, there's a reoccurring fund that goes into health professionals, loan for service scholarship, and it averages around $400,000 a year of non-reoccurring funds. We have at times put reoccurring, no, it's reoccurring funds that are in it on average of $400,000 a year. We've been asking for some non-reoccurring funds because they don't revert in this program. And so one way that the legislature could really help is to beef up those programs, to get them up to like $1 million and not around 400,000. And so that's something we try for every session, is to get money into those programs, because that really helps with the retention. And so that happens in House Bill 2. That has nothing to do with the legislation we're proposing. The legislation we're going to be proposing is going to be cost neutral, and so for the state. But definitely, I would urge the legislators to beef up those programs. Those loan for service programs are critical from everything I've seen. Does that answer the question?
Yes. Thank you. Thank you, Mr. Chair.
Thank you, Representative. And I have one or two final questions I'd like to ask Jerry Harrison. You, in your presentation, Jerry, you mentioned that the changing role or the increasing number of hospitalists has affected the primary care system in the state. I didn't understand the connection there. How does that work? What happens? And what is the problem that it causes?
There's a discipline that has developed called hospitalist, which a physician can treat patients in hospitals, and they typically do not have outpatient responsibilities. This has hit internal medicine, family medicine, and pediatrics extensively. The pay is starts at about $250,000, which is higher than what most outpatient primary care physicians will start at in New Mexico. on top of that, there are incentives around procedures. One of the features of being a hospitalist is that most of them work 7 days on and then have 7 days off. So it gives the illusion of being paid full-time while working half-time, even though it's a very concentrated and difficult position. The preference that many residents are making when they're coming out of this is across the country, not just in New Mexico, that they're preferring they're going to work in their discipline, but they're going to work in hospitals seeing patients in the hospital.
So they're essentially salaried by the hospital. They're employees of the hospital.
Correct.
And that then reduces the availability of outpatient primary care providers. Is that your point?
Correct.
Okay. And do all the hospitals now do that?
I can't speak for every single one, but I would say that most do.
The other question I had is, do you keep track of these various funds that we have, the tax credits, the loan for service, the the tuition repayment program, all of those different programs? Do you keep track of whether we're spending all the money in them or not?
I do not, sir.
So we really don't know if some of that money is going underutilized currently.
Mr. Chairman, I really doubt it. When I served on the advisory committee, we would get, say, 150 to 250 applicants a year, and then only be able to fund a handful of them. I would doubt if that has changed.
Okay. Well, this is certainly an area that we have a great deal of interest in, and I want to thank you, Jerry, and Mr. Hummer, President Hummer, and Dean Peratt for your presentations. It's been very educational for us, and we look forward to continuing the close collaboration. I'll just mention to you something I said before lunch, that I'm just really delighted to see the collaboration that's beginning to develop between Burrell and UNM on some of these programs, and I hope that we would see more and more of that in the future. It's too small a state not to have the synergy that your collaboration would generate. So thank you so much. Thank you for your presentation. And committee members, with that, I think we're ready to adjourn. Andrea, have I left anything unsaid?
Mr. Chair, no, I think what needs to be said has been said.
Okay, well, we meet again next Wednesday. Reminder for you to block your calendars out. We'll meet on the 21st. And don't forget, if you're one per diem, you have to make a special request each time to Sabina or one of the staff. So with that, thank you all. Have a great next week, and we'll see you next Wednesday. Bye-bye.
Okay, Chair. Thank you, everyone.
Thank you,
Great meeting. Great sharing. Thank you.
Yeah. Thank you.
Bye. Baby.
Bye. Thank you.
Thank you, Pilar, too.
Yes. Great job.
Bye, Joanne. Bye, Nancy. Bye, Senator.
Bye-bye.
Goodbye.
I hate to leave you. I'm so used to seeing everybody now. I'm in person. In video anyway, not in person, but this is as close as we'll get. Oh, wait. Hasta luego.
Thank you. Thank you, Andrea and Nancy and Sabina, all the staff. Thank you.
Yes. See you next week.
Thanks. See you next time.